on ancient medicine. Anyone who attempts to discuss medicine without a foundation in reality has fundamentally erred, and this mistake is more egregious given that medicine is crucial on life's most important occasions. Without a solid basis of knowledge, medical practitioners would all be equally unskilled and reliant on chance. However, we now see significant differences in skill and understanding among medical practitioners, just as we do with other arts. Therefore, one don't believe medicine requires an unnecessary hypothesis like those used for discussing the unknown, such as celestial or subterranean phenomena.
Without a reliable reference point, it's impossible to verify the truth of claims made about these mysterious topics.
Medicine, on the other hand, deals with tangible matters and can be judged by the outcomes of treatments and the knowledge demonstrated by practitioners. Medicine has already established its foundation and methodology, leading to numerous significant discoveries over time. Further breakthroughs can be expected if someone with the necessary expertise builds upon existing knowledge. However, attempting to bypass this established framework and claim new discoveries without understanding prior findings is both self-deceptive and misleading to others. One will now explain what medicine truly entails, making it clear that discoveries can only be made through this established approach. It's crucial for those discussing medicine to focus on topics relatable to the general public as they're concerned with the common people's ailments and their causes of origin, progression, and resolution. Illiterate individuals may not easily discover these answers themselves, but can comprehend them when presented by others, as it often resonates with personal experiences. To effectively communicate with the masses, one must cater to their level of understanding. Therefore, there is no need for complex hypotheses. Instead, focus on the diseases that affect everyday people and present findings in a way that resonates with their experiences. Medicine would not have developed if the same foods and regimens worked for both the healthy and sick, as people wouldn't need to investigate it. However, humanity discovered medicine because the same substances didn't work for everyone when they were ill.
Furthermore, one proposed that our current diet was not always so refined.
In the beginning, humans likely ate like other animals, consuming raw, unmixed fruits, grasses, and weeds without cooking or processing.
This rough diet would have led to frequent illnesses, early deaths, and a strong natural selection for those with stronger constitutions.
As people suffered from their unprocessed diet, they had to adapt by discovering new foods that better suited human nature. Through processes like grinding, sifting, baking, boiling, and roasting, humans transformed ingredients like wheat and barley into staples like bread and cake, masa. By moderating the strength of these substances with weaker ones, people created a more suitable diet for their own bodies, allowing them to thrive rather than suffer from diseases and early deaths. This discovery and refinement of foods for human health and well-being is what we call medicine, a field developed to replace our primitive diet and ensure nourishment, growth, and safety. One won't argue if we don't consider this a form of art. The fact that it's not unique knowledge, but rather something widely known through common practice and necessity, makes it less deserving of the title art. Nevertheless, making such discoveries still requires significant effort, skill, and inquiry. As people continue to explore and perfect their understanding of physical training and exercise, they often stumble upon new insights, continually improving their own strength and well-being in the process. Let's investigate the essence of medicine, which is a field developed for the benefit of the sick with its own name and practitioners. Does it aim to achieve the same goals as its inception? I believe that if diets suited people equally in health and sickness, there would be no need for medicine at all. That's why certain groups like barbarians and some Greeks don't use medicine.
They simply eat what they desire when sick or healthy.
Those who developed medicine, however, aimed to achieve the same goals as those one previously mentioned. Initially, they reduced the quantity of food consumed by patients, which alone could be beneficial for some but not all.
Some individuals are too weak to handle small amounts and need even weaker sustenance.
To accommodate this, soups were invented by diluting strong ingredients with water and boiling them down. Those unable to tolerate soups abandoned them and opted for drinks, carefully regulating their strength and quantity according to individual needs. The text highlights that not everyone can tolerate soup during an illness, as it may actually worsen their fever and pain. In such cases, even small amounts of solid food can be significantly more detrimental than soups alone. The key issue is the strength of the consumed substance relative to one's condition.
For individuals who should only have soups and no solid food, even a little bit of the latter can cause harm.
This principle applies universally. Stronger substances tend to cause more harm for humans, regardless of their health status. The person who developed a universal diet for humanity after it had been living in a primitive state is similar to the one who established medical practices. Both removed undesirable elements, one from food, the other from treatments, to make them suitable for human consumption or health. The primary difference between these two discoveries seems to be that the former was more straightforward and basic, while the latter allows for greater variety and requires more effort. In essence, both are about refinement and adaptation for human well-being. When comparing the diets of people in good health versus those who are ill, one might assume the latter's diet would be more detrimental. However, even a healthy person's diet can have negative consequences if they consume food meant for animals like oxen or horses, such as vetches and barley, in excess. Similarly, a sick person eating what is typically considered healthy human fare, like bread or cake, but in an unbalanced manner, will still experience adverse effects. This illustrates that the principles guiding medical discovery are akin to those of other sciences. Understanding the optimal balance and moderation in diet for both the well and the ill is crucial.
The notion that stronger substances harm while weaker ones benefit doesn't hold true.
In fact, excessive deprivation can be as detrimental as overindulgence. The key is finding a balanced measure, yet this balance can't be accurately determined by weight or calculation alone. It requires an understanding of the body's sensations to avoid small mistakes on either side. A physician who commits few errors deserves praise, but perfect accuracy is rare. Many doctors are like inexperienced pilots who may not cause significant damage in calm waters, but their incompetence becomes apparent during a crisis. While minor errors might go unnoticed in treating mild illnesses, they will be exposed when dealing with severe and life-threatening conditions. The consequences of such mistakes can be swift and severe. The consequences of unseasonable changes in one's diet can be just as detrimental as overeating. Some people thrive on a single daily meal, while others prefer 2 meals, but for most individuals, the choice between 1 or 2 meals does not significantly impact their health. However, there are certain individuals who cannot easily adapt to dietary changes without suffering negative consequences. If they deviate from their usual eating habits, even for just a day, they may experience drowsiness, lethargy, and thirst. And if they further alter their diet by adding an extra meal, they can develop symptoms like bloating, abdominal discomfort, and diarrhea. In some cases, these adverse effects can mark the beginning of a serious illness. Similarly, individuals who are accustomed to eating at specific times may experience fatigue, trembling, and lack of energy if they miss a meal or eat at an unusual time. They may also encounter issues with digestion, such as constipation, and experience vivid dreams or insomnia if they try to consume the same food at a different time of day. For these people, unseasonable dietary changes can have significant, unpleasant repercussions on their health. Let's examine the reasons behind these events. For someone who typically eats only once a day, their situation arose because they didn't allow sufficient time between meals for digestion and relaxation of the stomach.
Instead, they fed it while still hot and fermenting, which slows down digestion and requires more rest.
This is why those who skip meals or eat infrequently may experience unpleasant symptoms. On the other hand, someone accustomed to taking dinner will suffer if a new meal isn't provided after their body demands food and the previous one has been digested. Without this refreshment, they'll waste away due to lack of sustenance. The symptoms one described for this individual are all a result of not eating. Additionally, anyone in good health who goes without food for 2-3 days will likely experience similar adverse effects. A constitution that's sensitive to diet mistakes is inherently weaker than one that's more resilient. A weak person is close to being unwell, while someone sick is even more vulnerable. It's challenging for the medical art to consistently find the best approach, yet many cases demand precision. Nevertheless, one argue we shouldn't dismiss ancient medicine as flawed because it doesn't always achieve perfection. Instead, since it can arrive at great accuracy through reasoning, we should appreciate its accomplishments despite starting from a state of ignorance and acknowledge them as soundly made, not by chance. Let's shift the focus to the method used by those who investigate through hypotheses in medical science. If one of the 4 elements, hot, cold, moist, dry, is causing harm to a person, then the correct treatment would involve applying its opposite element. For instance, if someone is experiencing negative effects from something hot, you'd use something cold to remedy it. Let's take a hypothetical case. Suppose we have a frail individual who consumes raw wheat and uncooked meat with only water for sustenance. Given this diet, one's certain he would suffer severely, experiencing pain, weakness, and digestive issues. What is the best course of action in this situation?
Would it be applying heat, cold, moisture, or dryness?
The most obvious remedy here isn't about adding or subtracting one of these elements, but rather about changing the diet itself. Instead of raw wheat, offer bread. Replace raw meat with boiled meat, and introduce wine to their drink list. It's unlikely this person wouldn't benefit from such dietary changes unless they're severely debilitated by time and nutrition. So, in this case, did the change from raw wheat to bread remove the hot, cold, moist, or dry principle? Bread goes through both heat, fire, and moisture, water, involving various substances with distinct properties.
Some of these are lost during the process, while others are mixed together.
This paradox highlights the complexities of medical science when approached through hypotheses. The author emphasizes that the human body reacts differently to various types of bread and cake, depending on factors like grain type, moisture content, processing, baking, and more. Similarly, each person's body is influenced by these differences in food, affecting their health, recovery, or illness. The author argues that understanding these subtleties is crucial for grasping the causes of diseases. The ancient founders of medicine didn't believe that fundamental elements like dry, moist, hot, or cold were inherently harmful to humans. Rather, they considered extreme qualities, like intense sweetness, bitterness, acidity, and saltiness as the culprits behind harm when they dominate a substance. In the human body, various tastes and secretions exist in balance, but when anyone becomes dominant, it can cause problems. The author notes that most everyday foods like bread, cake, and other staples don't possess these intense qualities. Instead, they provide nourishment and support the body's functions because of their balanced composition. The exceptions are condiments and sweet treats, which are designed to delight the palate but can be excessive if consumed in large quantities. The author concludes that it is essential to comprehend these subtleties of food and their effects on the human body in order to understand health, illness, and the art of medicine itself. Those advocating for a hypothetical approach to medicine struggle to apply their principle practically. In reality, no substance is purely hot, cold, dry, or moist. All have multiple qualities. If one were to advise taking a hot remedy, the patient would ask what it is and probably opt for a familiar substance like food or drink. Since these substances often possess multiple properties, e.g. heat and sourness, prescribing them becomes complicated. For instance, a hot sour substance might have different effects than a hot insipid one. This confusion isn't limited to humans. Opposite qualities can produce disparate outcomes in even non-living objects like a wooden vessel or a bladder. It's not the hypothetical temperature or moisture that matters, but other qualities like sourness and insipidity, which affect both living beings and inanimate objects, regardless of how they are administered. Heat and cold, despite being significant factors in our bodies, have a relatively limited impact when not extreme. When they coexist, their effects are tempered, but when one dominates, discomfort or pain ensues. For instance, if someone takes a cold bath in winter, they'll feel heat rising once they're clothed and indoors. Similarly, after being warmed by a hot bath or fire, they may feel much colder once back in the cooler environment. This phenomenon is not unique to healthy individuals. It also applies to those who are ill. For example, during a fever, the patient often experiences chills that eventually subside as the fever breaks and sweat sets in, leaving them feeling cold. Given how quickly these extremes can shift and lose their potency, why do we consider this process a significant issue requiring extensive treatment? One might argue that individuals in severe illnesses like high fevers or pneumonia don't quickly recover from their elevated body temperatures, nor do they experience such rapid fluctuations of heat and cold. One proposed this very observation as the most compelling evidence that it's not solely due to heat that people enter a feverish state, nor is it the sole cause of the harm. Instead, it's the specific characteristics of heat, which can be bitter or acidic in nature, combined with other qualities like cold, that are actually detrimental. While heat does play a role and can intensify the effects, its individual strength is limited compared to the cumulative impact of these various factors. In reference to these symptoms, one can easily recognize those that are most evident, having experienced them ourselves. For instance, when someone has a runny nose and nasal discharge due to a cold, the current discharge tends to be much more acidic than what was previously expelled daily from their nostrils. This acridity leads to swelling of the nose and inflammation, which can be felt by applying one's hand to the area. It's extremely hot and ardent. Over time, if left untreated, this could lead to ulceration on the nose, even in the absence of soft tissue, making it hard and dry. The heat subsides, not when the discharge is present, but rather when the runny consistency thins out and loses its acridity, becoming more like the original nasal secretion. It's also worth noting that those cases solely resulting from cold, without involvement of any other factor, exhibit a rapid shift between hot and cold temperatures. However, symptoms linked to acidity and imbalanced bodily humours take longer to resolve as they require mixing and cooking within the body. Eye discharges rich in acrid properties can cause eyelid ulcers and even damage surrounding skin. Initially, such discharges bring pain, heat, and burning sensations. But once they're cooked down and congealed, they form crusts around the eyes, and the condition subsides. Similarly, throat afflictions like hoarseness or pneumonia begin with acrid, watery discharges that worsen symptoms. As these discharges thicken and lose their acidity, the conditions improve. In general, many human ailments arise from imbalances in 4 fundamental qualities: bitter, acidic, hot, cold. When an excess of yellow bile builds up, a person may experience anxiety, heat, and weakness. Relieving this buildup, either through natural means or medication, can bring relief. Similarly, acid imbalances can cause agitation, abdominal pain, and restlessness, which subside once the acids are purged or neutralized. The process of cooking, changing, and combining these qualities, humours, is crucial in understanding human health and disease. Time plays a significant role in these transformations. Hot and cold, being pure in nature, do not undergo putrefaction or thickening. They only lose their properties when mixed with each other. In contrast, all other humours mix well together to create harmony within the body, with the ideal state being one of balance and no dominant quality. One provided sufficient explanation on this topic, one believe. Certain experts argue that a physician must first understand human nature, origin, and construction in order to truly practice medicine effectively. However, this philosophical perspective is distinct from medical knowledge. One proposed that the true understanding of nature can be gained through the study of medicine itself, as it provides insight into the effects of various foods, drinks, and occupations on humans. It's not enough to simply know that a particular food is bad. One must also understand its specific impact, causes, and interactions with individual bodies. For example, excessive undiluted wine weakens a person due to its effect on certain bodily parts. Cheese has varying effects on people, as some can consume it without harm, while others may experience adverse reactions. A physician who grasps these differences in human responses will be better equipped to advise patients and avoid negative consequences. During recovery or prolonged illness, various complications can arise, some naturally occurring, others triggered by accidental factors like treatments or new foods. While well-intentioned, many doctors attribute these issues to recent changes in a patient's routine, such as taking a bath, going for a walk, or eating an unusual food.
Even if those actions were beneficial in the first place.
This approach is misguided. It's crucial to understand the effects of these activities on a person so they can be properly applied and avoid causing harm.
Without this knowledge, one cannot predict or manage the consequences of such interventions.
The author argues that understanding the role of both physical structure and internal juices, or powers, in the human body is crucial for grasping how diseases arise. He explains that he uses powers
To describe intense, strong bodily fluids and structures,
to refer to the various conformations within the body. He then compares different structures' abilities to attract and absorb humidity from another source, using the example of the mouth's ability to draw in liquids when lips are properly positioned or using a tube. He notes that hollow, broad parts tend to receive humidity but struggle to attract it, while solid, round parts cannot attract or retain humidity. The author suggests that spongy, rare structures like the spleen, lungs, and breasts excel at absorbing surrounding juices, growing harder and larger as a result. In contrast, the stomach's liquid contents are evacuated daily, whereas the spleen becomes rigid when it absorbs fluids, unable to digest or expel them. Gaseous emissions, flatulence, in the body tend to occur in hollow, broad areas like the stomach and chest, producing rumbling noises due to their movement. Conversely, apoplectic symptoms often arise in soft, fleshy parts. When gas encounters a dense, resisting structure like the liver, it causes pain, discomfort, and potential suppuration, abscesses, because of the liver's density, blood content, and inability to yield to pressure. The author also briefly mentions that similar symptoms can occur around the diaphragm, although less frequently due to its robust, expanded, and nervous nature. Despite this, chronic abscesses and pains do sometimes develop in the diaphragmic region. There are numerous types of bodily structures within and outside the human body, varying greatly in terms of both health and disease-related afflictions. These include characteristics like head size, neck length and thickness, belly shape, chest width, rib structure, and many others. It is essential to be familiar with these differences so that one can better understand their underlying causes and make more precise observations as a result. It's essential to understand the properties and interactions of different juices when it comes to human health. Now imagine a sweet-tasting juice undergoes an internal transformation without being altered by external mixtures. In this case, one believes its natural progression would be to become acidic, not bitter, salty, or austere. Given that an acidic juice is the most unsuitable option when a sweet one is called for. This concept can be applied universally. Knowing the properties of external things allows you to make better choices and select what's healthiest, which often means avoiding what's unhealthy. On airs, waters, and places. To truly understand medicine, one must consider various factors. First, the seasons, each producing distinct effects, should be studied. Then the prevailing winds, both hot and cold, as well as those unique to a specific region, require attention. The qualities of water, differing in taste, weight, and properties, are also crucial. When visiting an unfamiliar city, one must consider its location regarding wind directions and the sun's rising and setting points, as these factors have different influences depending on orientation. Pay close attention to the local water supply. Is it marshy, hard, salted, or running from rocky terrain?
Also examine the natural environment.
Does it lack water, feature forests, lie in a valley, or be elevated and cold? Lastly, observe the inhabitants' lifestyle. Are they sedentary, fond of excess, or active and industrious? These factors significantly impact people's health and should not be overlooked. From understanding the fundamental principles of nature and the celestial body's movements, a physician can extrapolate their knowledge to tackle various health issues. If they have a solid grasp on these basics, they won't be uncertain or make mistakes when encountering unfamiliar diseases in a new city. Moreover, by recognizing seasonal changes, astronomical patterns, and individual vulnerabilities, a knowledgeable doctor can anticipate epidemics, predict the year's trends, and effectively advise patients on maintaining their health. Although some may argue that this knowledge is more relevant to meteorology, it's undeniable that astronomy plays a significant role in medicine, as human physiology adapts to seasonal changes just like celestial bodies do. One will now explain how each factor one mentioned affects a region. In cities exposed to hot winds during certain times of the year and sheltered from northern winds, the water sources tend to be plentiful, salty, and fluctuate in temperature between hot in summer and cold in winter. The local inhabitants often have a constitution that is humid and pituitous, with excess phlegm draining down from their heads. This leads to frequent stomach issues.
They don't consume much food or drink, especially not wine when it comes to excessive drinking.
The region also sees specific diseases. Women suffer from heavy menstruation, infertility due to illness rather than natural causes, and frequent miscarriages. Infants are prone to convulsions and asthma, which locals consider a sacred condition, epilepsy. Men in the area experience dysentery, diarrhea, chronic fevers during winter, epinictes, hemorrhoids around the anus, and other endemic diseases. Acute illnesses like pleurisy, peripneumonia, and ardent fever are rare due to loose bowels.
The humid ophthalmies that do occur are generally mild and short-lived unless they spread epidemically with seasonal changes.
After 50 years of age, seniors may experience paralysis triggered by sudden exposure to sunlight or cold due to brain defluxions. They're also susceptible to any seasonal-related epidemics that arise. In locations where cities face cold winds during summer solstices and equinoxes and are shielded from southward heat and breezes, certain characteristics prevail. People's bodily fluids tend to be hard and cold, making them more prone to issues like constipation, biliousness, and ruptures of vessels. They're also susceptible to pleurisy and acute diseases due to bowel constriction. Excessive eating can exacerbate these conditions, but excessive drinking is less likely to occur since people can't be both gluttonous and drunk. As age increases, ophthalmies may develop, often leading to eye ruptures. Those under 30 are prone to severe nosebleeds in summer, while episodes of epilepsy are rare yet intense. People in such cities tend to live longer and have less severe ulcers that don't produce much discharge or spread malignantly. However, they're more aggressive by nature. Common seasonal illnesses can afflict both men and women, but women specifically struggle with irregular menstrual cycles, painful periods, difficult childbirth, and an inability to nurse their children due to the hardness of the water.
This also raises the risk of phthisis, tuberculosis, after childbirth.
Children in these cities often develop testicular dropsies at a young age, which resolve as they grow older, leading to a delay in reaching full physical maturity. In summary, this phenomenon is characteristic of locations exposed to cold and hot winds, with cities facing such conditions exhibiting the described traits. Cities situated between the summer and winter solstices, facing either towards or away from the rising sun, exhibit certain characteristics. Those cities that face the sunrise tend to be healthier compared to those that don't, even if they're only a short distance apart. The reasons for this are twofold. First, temperatures are more moderate due to the balanced exposure to heat and cold. Second, the waters flowing into these cities are clear, fragrant and pleasant to drink because the sun purifies them by dispelling morning vapours. The inhabitants of such cities generally have good complexions and a healthy appearance, unless illness intervenes. Their voices are clear, and they tend to be more intelligent and even tempered compared to those living in north-facing cities. The region's produce also benefits from this advantageous location. In terms of climate, these cities are like spring, neither too hot nor cold,
with fewer and milder diseases similar to those found in regions exposed to warm winds.
Women in these cities experience high fertility rates and relatively easy childbirths.
This is the case for cities situated between the solstices and facing the sunrise or its opposite.
Cities situated westward, shielded from eastern winds, and only occasionally touched by cold northern winds, typically experience poor air quality and unhealthy conditions. The water in these cities tends to be murky due to frequent morning mists that mix with the water, obscuring its clarity until the sun is high enough in the sky. In summer, chilly eastern breezes bring dew, while the setting sun heats up during late afternoon, leaving residents pale and weaken. They're prone to various diseases, but none are unique to this region. The people's voices often sound rough and hoarse due to the impure air, which lacks the clarifying effects of northern winds. The humid evening breezes prevalent in these cities are a notable characteristic. This environment bears a strong resemblance to autumn, with significant changes between morning and evening, as well as in terms of healthy or unhealthy wind patterns. The author wishes to discuss various types of water and their effects on health. He begins by describing stagnant or marshy water from lakes, which is often hot in summer due to the sun's heat, but can be congealed and muddy in winter. Drinking such water can lead to poor health, including enlarged spleens, emaciation, hoarseness, and a tendency towards dropsies and other diseases.
The author then contrasts this with healthy waters that come from elevated grounds or hills of earth.
He notes that these are often sweet, clear, and suitable for drinking with a small amount of wine added. They can have varying temperatures depending on the season. However, not all water is bad. Some springs, like those to the east, are considered the best, followed by those between the summer suns rising and setting. The worst waters come from southern directions. The author provides guidelines for choosing the right type of water based on an individual's health and constitution. For example, those with hard and easily burned bellies should drink sweet, light, and limpid water, while those with soft, loose, or pituitous bellies should choose harder, cruder, and saltier water to help dry them up.
Finally, the author warns against misperceiving the properties of salt waters, which are not purgative but rather binding and drying.
He concludes by emphasizing the importance of selecting the right type of spring water based on individual needs and circumstances. Rainwater is the lightest, sweetest, thinnest, and clearest type of water due to the sun's selective absorption of the thinnest and lightest particles. This process leaves behind salt and heavier impurities. The sun similarly extracts the thinnest part from other humid substances, including human sweat, which explains why we don't sweat in exposed areas, but do when covered. Rainwater deteriorates quickly due to its exposure to various contaminants and has a bad smell because of this mixture. When collected and carried by air currents, the cloudy or turbid parts condense into mist and clouds, while the lighter and sweeter portions are heated, concentrated, and sweetened by the sun before being dispersed. Eventually, these lightest particles can collect and thicken in the presence of contrary winds, forming clouds that eventually produce rain. However, rainwater often requires boiling and straining to remove impurities and unpleasant odors, which can cause hoarseness and a thickening of the voice if consumed unfiltered. Water from snow and ice is generally considered poor quality because once it freezes, its lighter and sweeter components are irretrievably lost, leaving behind only the heavier and more turbid parts. This is evident when measuring the volume of water before and after freezing, as the melted water will be significantly less in quantity due to the evaporation of the lightest particles during the congelation process. As such, one believes waters from snow and ice are the worst for all purposes. People who consume water from large rivers or lakes, where various streams converge, are prone to kidney problems, urinary issues, and even ruptures. This occurs because the diverse waters contain varying levels of sweet, salty, aluminous, and thermal properties, which can clash and cause the strongest characteristics to dominate, leading to the formation of deposits in the body that contribute to these health issues. The reason not everyone develops these problems despite drinking such water is due to individual differences. Those with loose bowels and a healthy state are less likely to form concretions in their bladders because they pass urine freely. In contrast, those with hot bellies and contracted bladders tend to have difficulties passing urine, causing the thickest parts of it to solidify and accumulate as stones. In children, calculi can also form from unhealthy, bilious milk that heats up their bowels and bladder, leading to similar changes in their urine. Diluted wine is recommended for children due to its less drying effect on their veins. Women are generally less susceptible to calculus formation because of the short and wide urethra, which allows easy expulsion of urine.
They also tend not to manipulate their genital area like men do when experiencing urinary difficulties.
Men who drink more than children are more prone to these issues due to their narrower urethrae and different drinking habits. The author notes that a year's health can be predicted by observing the seasons. If the autumn has rain, winter is mild, spring shows seasonal rainfall, and summer is hot without excessive humidity, it's likely to be a healthy year. However, if winter is dry and cold, spring is showery and warm, and summer is extremely hot, it will probably lead to ophthalmies, dysenteries, and other fevers due to the sudden heat and humidity. A southerly winter, showery spring, and southerly summer can cause the earth to be moistened by rain and heated by the sun, leading to an overload of humours in the body. This can result in acute fevers for phlegmatic people and dysenteries for those with a humid temperament, especially women. A dry winter and northerly spring, followed by southerly summer weather, increases the risk of miscarriage or delivering sickly children for pregnant women, as well as dysenteries, dry ophthalmies, and catarrhs for others. Phlegmatic men may develop dysenteries, while bilious people might get dry ophthalmies from the heat and dryness affecting their flesh. Older individuals with flabby veins are more susceptible to sudden death or paralysis due to a southerly winter and a northerly dry spring followed by hot summer weather. Cities situated well in terms of sunlight and winds, using good water, feel these seasonal changes less. Those that use marshy or pooly waters and have favourable exposure to the sun and winds experience them more severely. Dry summers tend to alleviate these diseases, while rainy ones prolong them.
There is also a risk of sores becoming phadodenic from any cause, with lientries and dropsies occurring at the end of illnesses due to the body's difficulty in drying out.
A rainy and southerly summer, followed by autumn, leads to a sickly winter, ardent fevers for phlegmatic people over 40 years old, and pleurisy and peritpneumonies for bilious individuals. A parched and northerly summer, but with a rainy and southerly autumn, can cause headaches, brain damage, hoarseness, coryza, coughs, and in some cases, consumption. A completely dry season without rain is most beneficial to phlegmatic people, those with a humid temperament, and women, as it helps them dry out. However, this type of weather is detrimental to bilious individuals, causing them to become parched, leading to dry phalmies, fevers, and in some cases, melancholy due to the consumption of their bile's most watery part, leaving behind its thickest and most acrid portion. Those who study seasonal patterns can anticipate most of their consequences on human health. During the most significant seasonal shifts, one should be cautious when administering treatments like medication, surgery, or cauterization in the abdominal area. It's best to wait at least 10 days after such changes. The solstices and equinoxes, particularly the summer solstice and autumnal equinox, are the most critical periods. Additionally, one should take heed of celestial events, the rising of Sirius, Arcturus, and the setting of the Pleiades.
These times often coincide with heightened health risks, with some cases proving fatal, others resolving or transforming into different conditions.
Similar patterns apply to these occurrences. The author aims to highlight the significant differences between Asia and Europe in terms of their natural environments, inhabitants, and physical characteristics. While it would be a long story to cover all the disparities, they will focus on the most notable distinctions. According to the author, Asia differs substantially from Europe due to its milder climate, more beautiful and larger productions of the earth, and gentle, affectionate dispositions of its people. This is attributed to Asia's equable temperature, lying in the middle of the sun's path, where neither extreme heat nor cold prevails. The Book of Prognostics. A physician should focus on developing their predictive skills in prognosis. By accurately forecasting a patient's condition, past habits, and future outcome, a doctor can gain the trust of their patients and their families. This foresight enables the physician to better manage treatment, as they'll be well prepared for the natural progression of the disease. Although it's impossible to heal every patient, having this predictive ability helps the doctor understand when a condition is beyond a patient's constitution, or even when there's an element of fate at play in the disease. As a result, the physician can wisely allocate their efforts and avoid criticism by accurately announcing which patients will survive and which won't, all while demonstrating their expertise. A physician should closely examine a patient's countenance in acute illnesses. A healthy-like or identical countenance is ideal, while an opposite one, e.g. sharp nose, hollow eyes, signals poor prognosis. If the initial countenance is concerning but later changes due to lack of sleep, diarrhea, or hunger, the danger might be reduced if these underlying causes are addressed. However, if the unfavorable countenance persists and no such explanations exist, it's a certain sign of impending death, especially within 24 hours. Similarly, if the disease has progressed on days 3 or 4, and the countenance is concerning along with other bad symptoms, eye discharge, squinting red whites, gummed eyes, it foretells a fatal outcome. In sleep, observing the eyes from below the eyelids can also be diagnostic. If white appears due to non-united eyelids and isn't related to diarrhea or medication, induced purging, it's an unfavorable sign of impending death. Contracted, pale, or livid eyelids, lips or nose, along with other concerning symptoms, are definitive signs of approaching mortality. A relaxed, cold, blanched, and dangling lip is also a mortal symptom. When a patient's physician finds them resting comfortably on either side with slightly bent hands, neck, and legs, and in a relaxed state, it mirrors their natural sleep position and is considered ideal. Lying on one's back with straight limbs is less favorable, while leaning forward or having cold, uncovered feet along with disoriented movements indicates intellectual aberration.
Sleeping with the mouth open, knees tightly bent, and lying on one's back is often a sign of a severe condition.
Unusual sleeping positions, such as lying on one's stomach without prior habit, may indicate delirium or abdominal pain. In acute diseases like pneumonia, struggling to sit up is a bad symptom, and grinding one's teeth without previous habit can foretell death. If the patient has a pre-existing ulcer that worsens or becomes dry, purple, or yellow before death, it's a sign of impending demise. These physical signs serve as early warnings for potential complications and outcomes in patients' conditions. During severe illnesses like fevers, pneumonia, phrenitis, or headaches, one's noticed that people tend to move their hands in a waving motion in front of their face, as if they're searching for something non-existent. This behavior, characterized by fidgety movements resembling the gathering of small items such as straw, dust, or chaff, is often an indication of a serious and potentially life-threatening condition. Frequent breathing can signal pain or inflammation above the diaphragm.
A deep breath taken at long intervals may indicate delirium.
On the other hand, labored breathing through the nose or mouth is often a poor sign. Easy and unlabored respiration, however, is generally beneficial for patients in acute illnesses like fevers that resolve within 40 days. Sweats that occur on critical days and effectively break the fever are highly beneficial. Sweats that cover the entire body, indicating a body coping well with the disease, also have a positive prognosis. On the other hand, cold sweats limited to the head, face, and neck in an acute fever suggest impending death, while in milder fevers, they indicate prolonged illness. Similar negative outcomes are associated with whole body sweats displaying characteristics of those confined to the neck. Sweats accompanied by a miliary rash around the neck also have unfavorable implications. Good sweats take the form of drops or vapor. It's crucial to consider the overall character of the sweat, as it can be linked to either physical exhaustion or the intensity of inflammation. A healthy hypochondrium is characterized by a painless, even size on both sides. However, inflammation, pain, or asymmetry in the hypochondrial region indicate potential complications. Rapid pupil motion may signal impending madness. Hard and painful swellings are concerning, especially if they occupy the entire area, but those on the left side tend to be less severe than those on the right. Swellings that appear initially often signify a rapid decline, whereas persistent swelling, after 20 days, can lead to suppuration. A nosebleed is an early indicator of good prognosis in these cases, although headaches or blurry vision may alter the outlook. Such episodes are more common among younger individuals, under 35.
Soft, painless swellings that yield to pressure indicate a more chronic illness and less severe outcome.
Prolonged fevers with unresolving swelling after 60 days suggest impending empyema. In the abdominal cavity, suppurative swellings are rarer below the navel than in the hypochondrium. Hemorrhaging is more likely from upper areas.
All prolonged swellings tend to become suppurative eventually.
The quality of abscesses can be assessed as follows. Externally draining abscesses with a small size and sharp point are favourable, while large and flat ones are unfavourable. Internally bursting abscesses without external manifestation are better than those that rupture externally. The ideal pus is white, uniform, smooth, and odourless, whereas the opposite signifies a poor outcome. Point 8. Dropsies caused by acute diseases are unfavourable because they don't alleviate the fever and can be very painful and even fatal. Most of them begin in the sides or lower back, but occasionally start in the liver. In cases that originate from the sides and lower back, swollen feet often accompany prolonged diarrhea, which fails to relieve the discomfort in these areas and hardens the abdominal area. On the other hand, dropsies linked to the liver are characterized by a tickling cough with little to no mucus discharge, as well as swollen feet. There may be occasional forced bowel movements, but no regular evacuations. Additionally, the belly can become swollen on one side or the other, and these swellings tend to wax and wane in size. A poor sign is when the head, hands, and feet feel cold while the stomach and sides are hot.
On the other hand, uniform heat throughout the body is a positive indication.
The patient should be able to move freely and display agility upon being lifted. However, if they appear heavy overall, including their extremities, this indicates greater danger. If, on top of heaviness, their fingernails and fingers turn blue, immediate death may ensue. Blackened hands and feet are less concerning than livid ones, but the overall condition must be assessed. If the person seems to tolerate the illness well and favourable symptoms emerge alongside these, there's hope for recovery, though affected body parts may eventually drop off. Retracted testicles and genitalia indicate severe pain and a high risk of death. In a healthy state, a person should follow a normal sleep pattern, being awake during the day and sleeping at night. Any deviation from this routine can be detrimental. However, if someone sleeps in the morning for only part of the day, it's less concerning than sleep disruptions later in the day or lack of sleep altogether. Insomnia often accompanies sadness, pain, or is a precursor to delirium. A person's stools should be soft, consistent, and in proportion to their intake. The frequency and quantity of bowel movements should resemble those when they were healthy. Fluid or excessive stooling can disrupt sleep and potentially lead to mental confusion. Ideal stool characteristics include being thicker as the disease nears a crisis, with a yellowish colour and minimal odour. It's beneficial if worms are passed during this time.
A soft and moderately distended belly is desirable throughout the illness.
Abnormal stool colours, such as watery, white, green or red, indicate poor health. Small, sticky, white, or green stools are also unfavourable, while black, fatty, livid, or strongly odorous stools are particularly concerning. Stools that vary in appearance may signal a prolonged illness, but are equally dangerous. Some abnormal stool types include those resembling scrapings, bilious, leak-like, or black stools, which may be passed alone or together. Passing wind without noise is ideal, and it's better to release gas than retain it. When wind passes quietly, it often indicates pain or delirium, unless the person naturally passes gas. Borberage me, rumbles of gas, in the hypochondria can relieve recent abdominal pains and swellings if accompanied by a bowel movement, urination, or flatulence. Even if not accompanied by these, borborygmi can still bring relief as it moves through the belly, especially when descending to the lower abdomen. A person's urine can indicate the severity and duration of an illness. If the sediment is white, smooth, and consistent throughout, it suggests a short and non-fatal illness. However, if the urine is sometimes clear and sometimes has sediment, the disease may be longer, lasting, and more dangerous. Reddish urine with smooth sediment indicates a prolonged but not necessarily fatal condition. Fur-like or leafy sediments are unfavorable signs, while white, thin sediment is particularly bad. Clouds in the urine are good, if they're white, but concerning if black. Yellow, thin urine suggests an unconcocted disease that may worsen if left untreated. The worst urines are those that are fetid, watery, black, or thick. In adults, black urine is the most unfavorable, while in children, watery urine is the worst. If someone consistently passes thin and crude urine as they recover from an illness, it may indicate a potential abscess below the diaphragm. Fatty substances floating on the surface of the urine are concerning because they signal melting. A negative development. The direction and colour of clouds in the urine can also be indicative of the disease's severity or recovery. Rising clouds with certain colours are unfavourable, while falling clouds with other colours are positive. However, if these abnormal urines occur when the bladder is diseased, it's a symptom of the specific issue rather than the overall health. When someone vomits a mixture of phlegm and bile, not overly thick or abundant, this is generally beneficial. On the other hand, more unbalanced or pure vomits tend to be worse.
Vomitus with colours similar to leeks, bluish black or black are unfavourable signs.
If an individual experiences all these colour variations in their vomit, it's a grave indicator of impending mortality. Of these, a bluish-black vomitus carrying a putrid odour is particularly alarming for its potential to signal immediate mortal danger. Generally, any strong, fetid smell accompanying vomiting is detrimental, regardless of the other characteristics. When experiencing chest and side pains related to lung issues, it's positive if phlegm can be easily coughed up with a yellowish tint. However, if the phlegm appears late in the process, has a yellow or reddish hue, causes significant coughing, or isn't strongly mixed with other expectorations, the situation is worse. Deep yellow or black phlegm is particularly concerning, while white, sticky, and round phlegm is essentially harmless. Green and frothy phlegm indicates a problem, but if no phlegm is expelled and the lungs are congested, it's a grave sign. It's unfavourable when respiratory issues are preceded or followed by runny nose and sneezing. In contrast, sneezing often signals recovery from other illnesses, even severe ones. A yellowish phlegm mixed with minimal blood, typically seen in pneumonia cases, is beneficial if produced early on, but becomes less favorable if it appears later. Phlegm that fails to alleviate pain is generally unfavorable, with black phlegm being the worst. Conversely, phlegm that relieves pain is the most desirable symptom of all. When persistent pain in the chest or abdomen persists, despite expectoration of sputum, bowel movements, bloodletting, medication, or a suitable diet, it's likely to culminate in suppuration. If the expectorated sputum is still bilious and occurs after day 7 of illness, the prognosis is grave. Patients with this characteristic typically die within 14 days, unless there's an improvement. Favorable signs include easy tolerance of the disease, unimpeded breathing, absence of pain, effortless expectoration, a warm and soft body temperature, lack of thirst and normal urine, stool, sleep, and sweat patterns. If these favorable symptoms are present, survival is likely. Conversely, unfavorable symptoms like difficulty bearing the disease, labored breathing, persistent pain, and difficulty coughing up sputum, along with strong thirst, uneven body heat, cold extremities, abnormal urination, stool, sleep, and sweat patterns, indicate a poor prognosis if they occur by day 9 or 11. The patient's outcome is typically fatal within the 14-day mark. Prognosis accuracy depends on balancing both positive and negative symptoms. In contrast to this severe condition, most other suppurations tend to burst later, sometimes as late as the 60th day. To anticipate when an abscess or pus-filled cavity will rupture and discharge, calculate from the onset of fever or rigor. If the patient reports feeling a weight in the area where they previously experienced pain, it may indicate the start of suppuration. Based on previous guidelines, estimate when the abscesses are likely to burst. For cases of empyema, pus-filled pleural space, affecting one side, turn the person and ask if they experience pain on the opposite side. If one side is hotter than the other, ask if a weight-like sensation is felt when lying on the healthy side. If so, the empyema likely affects the previously unaffected side. Empyema can be identified by several persistent symptoms: unrelenting fever with nocturnal spikes, excessive sweating, lack of productive coughing, sunken eyes, facial red spots, bent nails, hot fingers, swollen feet, loss of appetite, and small blisters, phleistinae, on the skin. In acute cases, these symptoms are accompanied by difficulty breathing, pain, and severe coughing and drooling. The likelihood of the abscess rupturing can be estimated based on the severity of these symptoms. If pain and respiratory distress occur at the onset, rupture might happen within 20 days or earlier. Milder symptoms suggest a later rupture. However, pain, shortness of breath, and excessive drooling must precede the rupture. Patients who recover quickly after abscess rupture tend to have their fever resolve on the same day, regaining appetite and experiencing small, consistent bowel movements with white, smooth, uniform stool that's free from phlegm, without discomfort or intense coughing. In contrast, those who die typically exhibit persistent fever, thirst without food desire, watery stools, green or frothy expectoration, or a combination of these symptoms. Ultimately, it is essential to consider all the symptoms collectively when making a judgment about a patient's condition and prognosis. This approach applies to other cases as well. When individuals recover from pneumonia, like afflictions, abscesses that form in the ear area or lower extremities, resulting in fistulas, are often a positive sign. However, if fever persists, pain doesn't subside, expectoration isn't normal, and bowel movements aren't regular with proper consistency, but other symptoms indicate recovery is underway, abscesses might still develop. These can form in the lower back, hypochondria. When phlegm collects there or in the upper regions, if hypochondrial softness persists without pain, accompanied by the resolution of dyspnea. Abscesses that occur after severe pneumonia attacks on the legs are generally beneficial, especially when they emerge as sputum transitions from yellow to a more purulent state and is easily expectorated. Under these circumstances, the patient's recovery is likely to be favorable. However, if expectoration is not free or the urine lacks proper sediment, there is a risk of complications, such as limb damage or prolonged illness. In cases where abscesses disappear, but fever and lack of expectoration persist, this is a poor sign, indicating a potential for delirium and death. Older individuals are more likely to die from empyema following peripneumonic afflictions, while younger people are more at risk in other types of empyema. For patients with empyema treated via cauterization or incision, recovery is more likely when the discharge is pure, white, and odorless. If the discharge is bloody and foul, smelling mortality is more probable. Severe abdominal pains accompanied by fever can be deadly if they spread to the diaphragm and worsen over time. It's crucial to monitor other symptoms as well, since a sudden deterioration can be fatal. However, if the condition is confined to the diaphragm but doesn't display unfavorable signs, it may resolve in empyema. A hard and painful bladder is an extremely bad sign, especially when accompanied by persistent fever. In such cases, even pain from the bladder alone can be fatal, as bowel movements cease or become difficult. If urine becomes purulent with a smooth sediment, it can bring relief to the patient. But if these urine characteristics don't improve and the bladder remains hard, along with continuous fever, the patient's death may occur early in the illness. This form of disease primarily affects children between 7 and 15 years old. The progression of fevers can be predicted based on their initial severity and symptoms. The mildest fevers typically end within 4 days or sooner, while the most severe ones often prove fatal within that time frame as well. Fevers are categorized into 6 classes, with each class increasing in duration by 4 days. 4th day, 7th day, 11th day, 14th day, 17th day, and 20th day. After these initial cycles, the progression continues in increments of 34, 40, and 60 days. The earliest stages of a fever are crucial to predict its outcome. Those who will recover typically exhibit favorable symptoms from the start, such as easy breathing, no pain, good sleep, and other positive signs. In contrast, those who will succumb display unfavorable symptoms like difficult respiration, delirium, insomnia, and more. By observing the initial symptoms and tracking the fever's progression in 4-day increments, it's possible to make an educated guess about its outcome. This pattern also applies to women after childbirth, where the crises follow a similar rhythm. Prolonged headaches with fever can be life-threatening, especially when accompanied by severe symptoms.
If a headache persists beyond 20 days without these grave signs, the risk of nosebleeds or abscesses increases.
Recently occurring pain is more likely to lead to nosebleeds or suppurations if it's located above the temples and forehead. Younger individuals under 30 are at higher risk for bleeding, while older people are more prone to suppuration. Severe ear pain accompanied by persistent and high fever is a worrisome combination, as it can lead to delirium and even death.
Therefore, it's crucial to closely monitor all symptoms from the onset.
The prognosis varies with age. Younger individuals typically succumb to this condition within 7 days or earlier, whereas older people may recover later since their fevers and delirium are less frequent. Elderly patients often develop ear abscesses before relapsing, which is usually fatal. Younger patients die before the ear abscesses form, except in cases where pus appears from the ear, offering hope for recovery if other favourable signs are present. A severe throat ulceration accompanied by fever poses a significant threat to one's life, especially when combined with other poor prognostic signs. Quinsys that occur internally without visible symptoms on the fauces or neck but cause great pain and breathing difficulties are particularly deadly, often leading to suffocation within a few days. Those quinsys characterized by throat swelling, redness, erythema, and pain are also fatal but may take longer to develop. When both the throat and neck display erythema, recovery is more likely, especially if the inflammation spreads to the breast and does not progress internally. If the condition persists without improvement or complication, death or relapse becomes a risk. Inflammation that remains outwardly contained is less hazardous, but when it affects the lungs, delirium may ensue, and in severe cases, empyema, a lung infection, can develop. It's crucial not to surgically remove enlarged uvulae while they are still inflamed and swollen, as this can lead to further inflammation and bleeding. Instead, try to reduce their size using alternative methods during this stage. Once the uvula has turned into an abscess or a specific type of quinsy, columella, has developed with distinct features, it is safer to perform surgery. If time permits, consider gentle bowel preparation before the operation, especially if the patient's condition is not already life-threatening and they are at risk of suffocation. When fevers subside without noticeable resolution, relapses may occur. If a fever persists beyond normal recovery time, joint inflammation, deposits, could develop, particularly in those under 30. In such cases, expect deposits to form faster and more frequently in younger individuals, and be more cautious of this occurrence after the fever has lasted over 20 days. Quartan fevers are more common in those over 30, while deposits tend to occur most readily during winter. If someone experiencing a non-fatal fever complains of headache, blurred vision, stomach discomfort, and later vomiting bile, rigor sets in, and hypochondrium is cold, expect severe vomiting soon. If instead of blurred vision, someone experiences dimness or flashing lights before their eyes and has hypochondrial fullness, without pain or inflammation, a nosebleed is more likely than vomiting. In general, younger individuals are more prone to nosebleeds during fevers, while those over 35 tend towards vomiting. Fever-related convulsions occur mainly in young children, typically under the age of 7, when they're constipated, restless, and experience colour changes. Children over this age or adults usually require strong fever symptoms before experiencing convulsions. Predicting recovery or death from an acute disease depends on a comprehensive assessment of the patient's symptoms.
These observations apply to acute diseases and their associated afflictions.
To accurately predict patient outcomes, including recovery or mortality, and anticipate the duration of illness based on the presence or absence of specific symptoms, one must first become familiar with these symptoms and their relative importance. This includes considering not only physical signs, but also external factors such as the spread of epidemics and seasonal influences, as seen in various regions like Libya, Delos, and Scythia. Understanding that certain unfavorable symptoms typically indicate poor outcomes while favorable ones suggest recovery can aid in making accurate judgment. While this text may not explicitly mention every disease, one can still recognize similar patterns and apply their knowledge to make correct assessments by considering the general characteristics of illnesses. On regimen in acute diseases. The authors of the Canadian sentences accurately described patient symptoms and outcomes, making it possible for non-physicians to identify them with proper questioning. However, they often neglected essential symptoms that physicians should know without the patient's report. The descriptions on treatment are where the biggest disagreement lies. One don't agree with their rules because they rely heavily on a few remedies. Drastic purgatives, whey and milk. Even if these were effective, which they're not, the limited number of treatments would be insufficient for various complaints. While some modern reworkings of the sentences provide more medical insight into treatments, the ancient texts still lack substantial information on regimen. Although the authors recognized the complexity of each complaint, their classification systems are incomplete and prone to oversplitting symptoms into distinct diseases if every variation received a unique name. One concur with paying attention to details in the field of art and medicine. In medical treatments, one advocate for efficiency, precision, and minimal discomfort when possible. However, it's the physician who excels at treating acute diseases like pleurisy, pneumonia, or fevers that truly deserves praise. These diseases are often fatal and account for a significant number of deaths compared to other illnesses. Unfortunately, the general public is not well equipped to distinguish between skilled physicians and their attendants.
But they tend to focus on unusual treatments rather than the quality of care.
This lack of discernment allows unqualified individuals to pose as physicians, mainly due to their familiarity with common remedies for acute diseases. The common misconception arises from the simplicity of recalling medication names like Patersan juice or hydromel, leading people to assume that anyone can be a skilled physician when prescribing such treatments. In reality, there's a significant difference between competent and incompetent medical practitioners in this area. It seems that certain medical practices lack clear guidelines or consensus among physicians, leading to significant variations in treatment approaches. For instance, some doctors consistently administer unstrained medicines, while others strain them or even delay administering medication for several days. These differences lead to confusion among the general public, who may wonder if medicine is a genuine science given such disparities. Comparing this to augury and divination, where different interpreters can have opposing views on the same sign or reading, it's surprising that these issues are not more thoroughly debated in the medical field. One argue that resolving such questions would greatly benefit patient recovery, health maintenance, and even athletic performance, making it an essential and influential topic within the art of medicine. One believe Patersan is the superior choice for treating certain grain-based diseases due to its smooth, consistent texture and lubricating properties. It quenches thirst without being astringent or causing digestive issues. Those using pitosan should maintain a steady supply of it, only pausing if administering medication or a clister is necessary. The dosage should be tailored to individual eating habits. Twice daily for those who usually eat twice a day, and once initially with the possibility of increasing to twice daily as needed. Initially, the amount of pitosan given shouldn't be excessive, but rather in proportion to the patient's usual food intake to avoid depleting their veins. If the disease is more dry than expected, hydromal or wine should be given before the Tyson, and if the mouth and lung passages are sufficiently moist, the pison dose can be increased, as an early crisis often indicates a positive outcome. In cases of purging, the pitosan dosage should be increased until the crisis passes, and then continued for 2 days beyond to maintain consistency. After this point, the pitosan is best given in the morning, with other food consumed at night. These guidelines are most effective when using pitosan containing its full substance from the start. The benefits of this approach include rapid relief of pleuritic pain, improved purging, reduced risk of empyema, and simpler earlier crises with fewer relapses, all compared to alternative regimens. Peptisans should be made with high-quality barley, thoroughly boiled, especially when not strained. This is crucial as it ensures the lubricating properties of well-boiled barley can help prevent digestive issues. Neglecting proper boiling and administration may cause harm, such as worsening pain or even death. If Tyson is given to someone already experiencing side pain that doesn't respond to warm compresses and their phlegm isn't brought up but remains thick and unprocessed, it can be fatal unless the bowels are loosened or a vein opened. The ancient Greeks believed those who died after consuming unstrained petosan were struck because when they passed away, the affected side turned blue, like someone who had been struck. This is often the case as people die before the pain subsides and their breathing becomes labored. As they struggle to breathe, mucus builds up in their lungs and can't be coughed out, leading to rowels, crackling sounds when inhaling, and ultimately death. This tragedy often occurs due to unseasonable consumption of pitosan or other harmful foods and drinks, which can worsen the condition by not allowing the phlegm to be expelled and intensifying the respiration difficulties. The effects of the medicine are similar, regardless of whether it's taken as a drink or in its unstrained form. However, the physician should adjust their approach based on the patient's condition. If fever sets in shortly after eating and before bowel movement, the draught should be withheld until food has moved into the lower part of the stomach. Oxymel can be used to alleviate pain, while hydromel and water help with thirst. In cases where symptoms worsen or danger signs appear, a smaller dose of the medicine should be given, and this is especially true after the 7th day if the patient is strong. If food hasn't moved through the digestive system, a clyster or suppository might be necessary to stimulate bowel movement. It's crucial to pay attention to the timing of administering the draught, particularly during the early stages of illness. When the patient's feet are cold, it's best to avoid giving the medicine and drinking, but once their body temperature returns to normal, the treatment can resume. This period is critical in all diseases, especially acute febrile ones, and it should be closely monitored. The treatment plan may involve initially using the juice and then transitioning to the tisane, following established guidelines.
When pain strikes the side at any point during the illness, applying heat can help alleviate it.
The most effective method is using hot water in a container or wrapped cloth, making sure to cover the soft application to retain the heat and prevent vapors from being inhaled unless desired. Alternatively, you can infuse barley, Therese, or bran in vinegar and apply them in cloth bags for dry fomentations that soothe pain. If pain persists and extends to the clavicle, venesection may be necessary. However, if other treatments don't provide relief within a reasonable time, applying heat too frequently can cause lung congestion and promote suppuration. In cases where the pain radiates to the arm, breast, or above the diaphragm and reaches the clavicle, perform venesection until the blood turns reddish, livid. For lower abdominal pain, not extending to the clavicle, consider opening the belly with hellebore mixed with a fragrant herb or using peplium with asafoetida. These mixtures can effectively stop the pain. In addition to internal remedies, laxative draughts can also help alleviate symptoms if well tolerated by the patient. When administering these treatments, it's essential to monitor and adjust dosages based on the individual's response, gradually increasing doses until the pain subsides or until a crisis occurs in the disease progression.
One hold the view that administering a tisane should follow certain guidelines.
Similarly, regardless of the type of drink administered, the same basic principles apply. One aware that many physicians contradict this approach by initially fasting their patients for 2-3 days or more before introducing pitasanes and drinks, likely reasoning that one significant change in the body should be countered by another. However, inducing a change is not insignificant. It must be done thoughtfully and with caution, followed by judicious reintroduction of food. Those using unstrained petisane tisane juice alone, or just drink, will suffer if these guidelines are not adhered to, but those who consume only drinks would likely fare the best. The author argues that people should not drastically alter their diet, especially if they're generally healthy. Sudden changes can lead to discomfort, weakness, and other negative effects. Those who typically eat 2 meals a day might feel weak and heavy after eating dinner, while those accustomed to 1 meal a day may experience fatigue, heartburn, and digestive issues if they suddenly start eating 3 times a day.
The author suggests that people should stick to their usual diet and habits when it comes to food intake.
Avoiding sudden changes can help prevent discomfort and promote better health. For example, someone who usually eats 1 meal a day might feel worse than usual after missing dinner, but then eating a larger than usual supper. Similarly, they may struggle if they eat again too soon the next day. The author also notes that people's reactions to diet changes can vary based on their individual characteristics and constitutions. Some individuals with certain conditions, like biliousness, are more negatively affected by such changes than others, like those who are pituitous. Ultimately, the author believes that making significant changes to one's diet is not advisable when it comes to maintaining health, especially during periods of illness or stress.
It's best to stick with what works and avoid sudden drastic alterations.
Many people are tolerant of food and drink they're familiar with, even if it's not inherently good, but react negatively to unfamiliar items, even if they're not bad. This can be seen in reactions to eating large amounts of meat or strong-tasting foods like garlic or asafoetida. When an individual eats something new, like the flatulent-inducing marza, it can cause stomach discomfort and issues. The same is true for bread. Its effects on digestion vary depending on whether someone's used to it or not. The type of bread, fine, coarse, or its moisture level also affects digestion. Similarly, switching from a diet of polenta to another food, or vice versa, causes different reactions in those accustomed versus unaccustomed to it. Drinking wine or water regularly and then suddenly switching can cause issues like stomach upset, bloating, headaches, or thirst. Even the colour and strength of wine can affect people differently if they're not used to it. The sudden introduction of a strong, sweet wine can have distinct effects on the body compared to its usual intake. This highlights that individual tolerance to food and drink is influenced by familiarity, with negative reactions often occurring when something new is introduced contrary to custom. A counterargument suggests that patients' dietary changes occur without a corresponding change in their physical strength or weakness, and therefore no adjustments are needed. However, one must consider the patient's overall health, the nature of the disease, their constitution, and usual diet. Augmentation of food can often be beneficial if done at the right time, but sometimes abstinence is necessary until the disease reaches its peak and is fully developed. It's noted that mistakes in early dietary choices don't cause long-lasting harm, unlike drastic changes later on. This serves as a strong evidence point against prescribing certain diets from the start, especially when they might not be suitable for the patient's condition. The author argues that physicians often enforce total abstinence or change to paytisans at the wrong times, leading to negative consequences. In some cases, patients experience severe symptoms like delirium, anxiety, and respiratory distress if they don't receive proper diet and treatment early on. The author suggests that physicians lack knowledge about such conditions and how to treat them effectively. It's emphasized that recognizing the correct cause of debility, e.g. pain or inactivity, is crucial for successful treatment, as mistaking one for the other can have serious consequences. If a patient is mistakenly deprived of food due to perceived inanition, while actually being weakened by pain or disease, it may not be immediately harmful, but can lead to ridicule if another physician corrects the mistake and brings about improvement in the patient's condition. When the entire body is unusually idle or suddenly subjected to intense activity, it reveals its weakness. This applies not just to the bowels, but to all parts of the body, even the teeth, eyes, and feet. Similarly, a bed that's too soft or hard than usual can cause discomfort, as does sleeping outdoors if one isn't accustomed to it. Take the example of someone with a minor leg wound. If they initially rest in bed without moving their injured leg, it will heal more quickly and with less inflammation compared to walking around during recovery. However, if they suddenly start walking or engaging in strenuous activities too early, they'll experience more discomfort than if they had done so from the beginning of the healing process. These observations collectively demonstrate that sudden and extreme changes are detrimental to the body's well-being. For instance, feeding someone with a severe lack of food an excessive amount can cause harm, just as abruptly switching from a heavy diet to complete fasting or transitioning from intense physical activity to complete idleness. In these cases, the body often requires prolonged rest to recover from such disruptions. Most of my previous discussion has focused on transformations or shifts in various contexts. Understanding these concepts is valuable, especially when dealing with acute illnesses that transition from malnutrition to phlegmatic conditions, as one explained. It's crucial not to apply phlegm-inducing treatments until the disease has been processed or other symptoms emerge in the digestive system or hypochondria, as described later. Prolonged sleepiness can disrupt digestion and overall bodily functions, leading to a state of heat and heaviness in the head. To determine when to use wine, sweet, strong, dark hydromel, water or oxymel in acute diseases based on symptoms, one must consider their effects on the body. Sweet wine primarily affects the digestive system, inducing bowel movements but causing swelling of the liver and spleen. It can be too drying for those with a bilious temperament and may cause long-lasting flatulence. While it's less diuretic than strong wine, sweet wine is more expectorant. Strong wine, on the other hand, is more diuretic and laxative, making it suitable in cases where urinary retention or constipation is present. For those who don't exhibit symptoms of heaviness of the head, delirium, or difficulty expectorating, a switch to yellow or dark wines might be beneficial if alveolar discharges are loose and abnormal. Darker wines, especially stronger ones, can prove more beneficial for bowel health, but may cause harm to the upper digestive system and bladder if used in excess. In summary,
sweet wine
induces bowel movements, causes flatulence, less diuretic, more expectorant. Strong wine, diuretic, laxative, suitable for urinary retention or constipation. Yellow or dark wines can be beneficial alternatives for those without symptoms of heaviness, delirium, or difficulty expectorating, and may aid in bowel health, but be harsher on the upper digestive system and bladder. Hydromel's suitability depends on individual characteristics. It might not be ideal for those with a bilious temperament or enlarged viscera. Compared to sweet wine, hydromel increases thirst less and has detergent properties that help soften lungs and ease coughs by lubricating sputum. It is also moderately diuretic, but can cause excessive, intense, and frothy bile discharges in some individuals, especially those with a bilious temperament or enlarged viscera. Unmixed hydromel tends to produce these unwanted side effects more than diluted hydromel. However, when used as the sole beverage during treatment of certain diseases, hydromel is often effective and reliable. Some mistakenly believe that hydromel weakens the body's powers and accelerates death, but this misconception arises from people who starve themselves to death while relying solely on hydromel. In reality, hydromel can be stronger or weaker than wine, depending on the individual. It is essential to consider its effects on one's bowels. When used in combination with paysands, hydromel can have adverse effects. However, consuming it before a partisan drink might mitigate these negative consequences. Boiled hydromel has a clearer appearance, but no superior qualities compared to unboiled hydromel. Nonetheless, boiling is recommended when the honey is of poor quality, as it can remove most of its imperfections and unpleasant traits. The drink oxymel can be very useful in treating respiratory issues like difficulty breathing and coughing. It helps loosen phlegm and make expectoration easier by bringing up sputum that would otherwise cause troublesome hacking. However, if it's too acidic, it may have the opposite effect in some cases, making phlegm more viscous and causing harm. In such situations, oxymel should be given in small amounts at a lukewarm temperature. Oxymel can also be slightly acidic and act as an expectorant, moisturizing the mouth and throat, promoting bowel movements, and being diuretic. However, it may cause watery stools or scrapings from the lower intestine in some cases, which is undesirable in acute diseases when there's no relief for flatulence. Oxymel might be a good choice as a prelude to taking paysan at night, but not always suitable if someone is restricted to only drinking and not taking medicines. Adding a small amount of vinegar to oxymel can balance out its negative effects and enhance its benefits. Vinegar itself has a beneficial effect on those with bitter bile, turning it into phlegm-like substance. However, it may exacerbate black bile and be more detrimental to women due to its uterine pain-inducing properties. Men are less affected by vinegar's potential drawbacks.
Water doesn't offer significant relief for coughs or promote expectoration in acute diseases on its own.
However, when taken in small amounts between oxymal and hydromal, it can aid in expectoration by altering the drink's properties. Water is not an effective thirst quencher, as it tends to produce bile in bilious individuals and can harm the hypochondrium. It's particularly harmful when the bowels are empty and can worsen inflammation of the liver and spleen. Drinking water can also cause stomach discomfort, slow digestion, and fail to induce bowel movements or urination. If cold feet accompany illness, water's negative effects may be exacerbated in those areas. In cases of severe headaches or mental confusion, wine should be avoided and replaced with water or a weak, unscented wine, followed by a small amount of water. The proper use of water, whether in large, moderate, hot, or cold quantities, will be discussed later. Similarly, the usage of other beverages like barley water, green shoot drinks, raisin-based drinks, grape and wheat skin infusions, saffron, myrtle, pomegranate, and others will be addressed when relevant to a specific disease. The bath can be a valuable treatment for various illnesses, but its effectiveness depends on several factors. Firstly, there must be suitable facilities and trained attendants to ensure proper usage. The patient should be clean, warm, and comfortable throughout the process.
A well-ventilated area is crucial, along with an adequate supply of water and suitable bathing materials. Friction should be avoided or minimized, replaced by abundant use of hot soap and gentle water effusions. The head should be thoroughly dried after bathing, while the rest of the body should be anointed when still slightly damp.
The extremities and head must be protected from cold, and there should be a gap of time between taking medicine and bathing. The bath is generally more beneficial for patients with pneumonia than those with high fevers, as it soothes pain and alleviates symptoms such as fatigue and respiratory issues. However, certain individuals may not benefit from or might even be harmed by the bath, including those with loose bowels, severe constipation without prior evacuation, or conditions like nausea, vomiting, hemorrhage, and dehydration. In general, the frequency of bathing depends on individual tolerance and the patient's underlying condition. The bath is most suitable for those taking unstrained pitosan, followed by those who consume only its juice. It is least suitable for those using plain drink as their regimen. Ultimately, a judgment must be made based on these guidelines to determine whether the bath will be beneficial or not. Book 1 of the Epidemics, Section 1. Constitution first. In Tharsis, around the autumnal equinox, the weather was characterized by abundant and consistent rains, soft and southerly winds during autumn and winter, and a milder spring. The summer was mostly cloudy, with little rain and irregular Artesian winds. This southern-leaning seasonal pattern occasionally led to mild fevers and ardent swellings around the ears, which were not accompanied by fever and resolved without issue. These ear swellings occurred more frequently among men who engaged in physical activities, such as those at the palastra or gymnasium, but were less common among women. Some individuals experienced dry coughs with hoarseness of voice, while a few developed painful testicular inflammation, either singly or bilaterally, sometimes accompanied by fever. These issues did not require medical attention and generally had a benign outcome. During the transition from spring to summer and into winter, many individuals who had been steadily declining took to bed with symptoms of tuberculosis. In some cases, a previously uncertain diagnosis was confirmed, revealing a constitution prone to this disease. The majority of these patients died suddenly, without surviving for an extended period. However, other protracted illnesses accompanied by fever were better tolerated and did not result in fatalities. Consumption was the primary deadly affliction during this time, and it claimed many lives. Most patients experienced symptoms that included continuous fevers with rigors, no complete remission of these fevers, but rather they would ebb and flow in intensity, constant sweating, except on the entire body, cold extremities that were difficult to warm, disordered bowels with frequent, bilious, thin and pungent bowel movements. Urinary symptoms included thin, colourless, or thick urine with an inadequate sediment that failed to settle properly. In some cases, a crude and premature sediment formed. Patients also experienced small, dense, and well-cooked sputum, but this was rare and often difficult to expel. In the most severe cases, there was no cooking of the sputum, only the continuous expulsion of raw matter. The majority of patients had painful throats from beginning to end, with redness and inflammation. They exhibited thin, small, and acrid deflections that quickly worsened as they rapidly wasted away, showing no appetite for food throughout their illness. Most patients also became delirious near the point of death. These were the characteristic features of physical affections. During summer and autumn, many people experiencing ongoing non-violent fevers developed mild symptoms. Those already weakened by illness didn't exhibit extreme discomfort, except for moderate bowel issues that didn't significantly impact them.
Urine was generally clear and became more normalized as the disease progressed.
Coughs were minimal and not troublesome, appetites remained good, and food was necessary to sustain them. These individuals suffered from fevers, chills, and inadequate sweating with irregular, non-intermittent paroxysms that sometimes took a tertian, recurring every other day, form. The first crisis usually occurred around the 20th day, but most people experienced it by the 40th or 80th day. However, some patients didn't reach a crisis point and instead went into relapse, eventually reaching a crisis at their typical intervals. In many cases, these relapses prolonged the disease, leaving some without resolution by winter. Of the described conditions, only those with phthisis, tuberculosis, had fatal outcomes. In all other cases, patients recovered from the fevers and didn't die as a result. Section 1, Constitution 2nd. During an unusual and severe winter in Phthisis, the weather was characterized by frequent and heavy rainfall, northerly and southerly winds, snow, and intermittent periods of fair weather. The cold season persisted until the equinox. Spring was similarly cold, wet and northerly, while summer was not hot but did have some rain and north winds around the time of Arcturus's rising. The unusual weather led to a variety of health issues. In winter, many people experienced ophthalmic complaints, rheums, pains, and other ailments that persisted until late autumn. During summer and autumn, there were cases of dysentery, tenesmus, lyentery, and bilious diarrhea. Some patients had copious defluxions with pain, while others experienced vomiting, sweating, and excess humours. In the autumn and early winter, physical complaints and fevers increased in number. There were ardent, diurnal, nocturnal, semi-tertian, true tertian, quartan, and irregular fevers. The most common fevers were the regular quartans, but there were also cases where fevers transitioned from one type to another. Many patients experienced convulsions, especially children, which often accompanied fever. Some fevers had exacerbations in a tertian form, with small remissions followed by increasingly violent paroxysms. Common symptoms of these diseases included rigors, sweats, cold extremities, insomnolency, and coma. Bowel disorders were prevalent, with urine being thin, crude, yellow, or muddy, often containing small and bad sediments. Coughs occurred in some cases, but did not have a significant impact. Most patients experienced prolonged and troublesome fevers that did not terminate in a crisis. A few instances of abscesses formed in the latter stages of these diseases, either unusually large or small, but they rarely brought about a crisis. The most severe symptom was an intense loathing for food, especially among those with fatal symptoms. The diseases affected people of all ages, but children under 10 and infants just weaned were particularly vulnerable. Those who developed strangury, often accompanied by abscesses, had better prognosis and typically recovered from their fevers and other ailments. When dealing with these health cases, it's crucial to pay attention to the quality of excretions and abscesses at each stage of treatment. A well-cooked evacuation often signals a swift recovery, whereas unprocessed or poorly digested evacuations can indicate a prolonged illness, relapse, pain, or even death. The physician must consider past health history, current condition, and potential outcomes to make informed decisions. Their primary objectives are to either do good for the patient or avoid causing harm. The art of medicine is centered on three interconnected aspects: the disease itself, the individual patient, and the physician's expertise. As a servant of this art, the physician works in tandem with the patient to combat the illness. Individuals may experience headaches, neck pain, and heaviness in these areas, either without a fever or with one present. In some instances, seizures can occur, often proving fatal if accompanied by green bile vomiting. When fevers are severe or characterized by neck pain, temple heaviness, blurred vision, and stomach discomfort, nosebleeds may happen. Those experiencing overall head heaviness, chest pain, nausea, and regurgitating bitter or pituitous substances tend to be older adults. Children in these situations often develop seizures, while women experience seizures along with uterine pain. Elderly individuals or those whose fevers are mild may recover with paralysis, mania, or loss of sight as the initial heat subsides. Third constitution. In Tharsis, the weather patterns varied throughout the year. There were heavy northerly rains with strong winds around the time of Arcturus. A short period around the equinox and until the Pleiades set saw occasional southern rainfall. The winter was characterized by cold, dry, and snowy conditions with powerful northwesterly gales.
Spring brought more northerly weather, a scarcity of rain, and low temperatures.
Summer initially experienced meager precipitation and frigid temperatures up to the time of the dog star. Following the dog days, an extended hot summer ensued, marked by severe droughts and no rainfall, accompanied by Etesian winds. As Arcturus season approached, southerly rains returned until the equinox, signaling a shift back to northerly patterns. During winter, a severe disease affected many people, causing paralysis, paraplegia. Although the disease was widespread, individuals remained resistant to other illnesses. As spring arrived, ardent fevers emerged and persisted through summer, but most people recovered with proper treatment. However, autumn brought a deadlier form of the fever, resulting in a higher mortality rate. A key factor in recovery from these fevers was copious nasal bleeding, epistaxis, which seemed to save lives. Those who did not experience this hemorrhage were more likely to die or suffer severe complications like jaundice and bowel disorders. Dysentery was another common outcome, particularly among those who had not experienced the beneficial nasal bleeding. In some cases, the fever's aftermath led to dysentery, even if the initial crisis had been successfully navigated. Women were less affected by the disease than men, but those who became ill often faced difficult childbirths and subsequent fevers that could prove fatal. The menstrual cycle was disrupted in many women, including girls experiencing their first period due to the fever. In some cases, both menstruation and nasal bleeding occurred simultaneously, which seemed to guarantee survival. The pregnant were particularly vulnerable, with most experiencing miscarriages or stillbirths upon contracting the disease.
Urine analysis revealed that most patients had clear but thin urine, often lacking normal sedimentation.
After recovery from the initial crisis, a subset of patients later developed dysentery, prompting speculation about whether watery urine might be a contributing factor. Around the time of the star Arcturus, many patients experienced their crisis on the 11th day, and they were less likely to relapse or die compared to others. Children in particular seemed more resistant during this period. A particular fever pattern occurred around the equinox and persisted until the Pleiades season, intensifying during winter. Many people experienced ardent fevers with severe symptoms, including delirium, thirst, nausea, cold extremities, and no general sweating. These symptoms often led to death on the 6th day. In some cases, the fever was milder initially but grew more violent around the 7th day. The disease typically ran its course in 11-20 days, with a crisis occurring on the 6th or 11th day.
If the crisis didn't happen as expected, the patient might experience multiple relapses before finally recovering.
Some notable exceptions were people experiencing a hemorrhage from the nose, a copious urine discharge, or a bilious bowel movement, which often marked a turning point in their recovery. Women and girls seemed more susceptible to this fever pattern, but most recovered if they exhibited these favorable symptoms. The timing of crises varied depending on the individual, with many people experiencing a crisis around the 6th day, then going into remission for 6 days before relapsing and having another crisis. Some people had a different sequence of events, such as a 7th-day crisis, followed by an intermission and then a 4th-day crisis after relapse. In general, those who died from this fever pattern were infants, young adults, with smooth skin and dark features, reckless or luxurious individuals, and women. The disease was most prevalent during winter, particularly around the winter solstices, and ardent fevers and frenzies dominated the season until the equinox. As the seasons changed, so did the symptoms and outcomes of the fever pattern, with fewer cases of rigor in spring, more in summer, and even more in autumn, before reaching a peak in winter, when hemorrhages ceased. Section 1.1. When evaluating diseases, it's essential to consider various factors: the general nature of the disease, as well as its unique characteristics for each individual patient. One should also take into account the treatments applied, the healthcare provider administering them, seasonal conditions, celestial influences, and regional specifics. Additionally, a patient's lifestyle habits, daily routine, social interactions, emotional state, sleep patterns, or lack thereof, dreams, and physical symptoms like picking, scratching, and discharges from the body are crucial factors to consider. The progression of diseases, deposits or excretions, sweat, temperature changes, coughing, sneezing, belching, flatulence, respiration, and any hemorrhaging or hemorrhoidal issues should all be evaluated when forming a judgment about a disease. Fever types can vary greatly, including continuous fevers that persist throughout the day or night with varying intensities, as well as semi-tertian, tertian, quartan, quintan, septan, and nonan fevers, each with distinct. The most severe and potentially fatal fevers are often the continuous ones. On the other hand, quartans tend to be mild and prolonged. Semitertians can trigger other acute illnesses and are particularly deadly for those already suffering from chronic conditions like phthisis, tuberculosis. Nocturnal and diurnal fevers can be protracted but not typically fatal. Septans and nonans are generally not life-threatening, with septans being more prolonged than nonans. Each fever type exhibits unique patterns of constitution, paroxysms, and progression. For instance, some continuous fevers start mild and gradually worsen, while others begin strong and then subside around the crisis point. Understanding these variations is crucial for tailoring treatment regimens. Additional important symptoms are connected to these fever types, some of which have already been discussed, with more to be covered later. By analyzing these signs, healthcare providers can determine whether a disease is acute or chronic, whether it will be fatal or lead to recovery, and when to administer food, what type of food to give, and in what quantity. The text discusses a pattern in the timing of paroxysms and crises of certain diseases. Those that experience paroxysms on even-numbered days tend to have crises on even-numbered days as well, while those with uneven day paroxysms typically have uneven day crises. The text lists specific periods for each group: 4th, 6th, 8th, etc. For even day crises and 1st, 3rd, 5th, etc. for uneven day crises. It warns that if a crisis doesn't occur on these days, it may signal a relapse that could be fatal. The text also emphasizes the importance of understanding which crises lead to recovery or negative outcomes, especially in cases like irregular fevers and their variants quartans, quintans, septans, nonans. 14 cases of disease. Philiscus, residing near the wall, fell ill with acute fever on the first day.
He had a feverish night with sweating and discomfort.
On the second day, symptoms worsened. He experienced relief after passing stool through a cloister in the evening, then slept well at night. The next morning to noon, his fever seemed to subside, but by evening it flared up again with sweating, thirst, and dark urine, accompanied by delirium throughout the night. On the fourth day, symptoms intensified with black urine. That night was relatively more comfortable. On the fifth, he experienced a small nosebleed around midday. His urine showed unusual characteristics:
floating round bodies resembling semen but no sediment at the bottom.
A suppository brought some passing of gas, and he had a restless, sleepless night with incoherent talking. His extremities remained cold, unresponsive to warming. Throughout his illness, his breathing was irregular, as if recalling himself, and his spleen developed into a rounded tumor. Feverish sweats persisted, with paroxysms occurring on the second and fourth days.
He eventually died around mid-sixth day, still experiencing loss of speech, cold sweats, and livid extremities.
Case 2. Silenus, living on the broad way near Evalcidas's house, developed fever due to fatigue, excessive drinking, and unseasonable physical activities. The symptoms began with pain in the lower back, heavy head, stiff neck, and bilious diarrhea. Over time, his condition worsened. Day 1.
Fever started with bilious, frothy stools, black urine, thirst, dry tongue, and insomnia.
Day 2. Fever increased. Stools became thinner and more copious. Urine remained black. He had an uncomfortable night with slight delirium. Day 3, 4. Symptoms worsened. Abdominal distension, dark-colored stools, muddy urine, no sleep and excessive talking, laughing and singing. Day 5. Stools turned bilious, smooth and greasy. Urine became thin and transparent. Delirium decreased slightly. Day 6E.
He experienced sweating on the head, cold extremities, restlessness, and a cessation of bowel movements and urine output due to acute fever.
Day 7. Silenus lost his ability to speak. His extremities no longer retained warmth. There was no urine output. Day 8-9. The patient had a general sweat with small persistent rashes, like variola, undigested stools, painful urination, and comatose sleep.
He remained speechless.
Day 10. Silenus took no fluids, slept lightly, had the same bowel movements, and passed abundant but thin urine. His extremities cooled again. On day 11, Silenus died at around age 20. Throughout his illness, he experienced slow and deep breathing, persistent throbbing in the hypochondrium, and a fever that lasted for 10 days before death. Case 3. Hierophon developed an acute fever and initially experienced infrequent tenesmus, attended bowel movements. The discharges later turned bilious and frequent. He suffered from insomnia, dark, thin urine, and by the 5th day he became deaf and his symptoms worsened, with a swollen spleen and abdominal distension. Bowel movements became scanty and black, and delirium set in. On the 6th day, he continued to be delirious at night, but showed signs of sweating and coldness. His mental clarity improved on the 7th day, only to experience feverishness again, with a reduced spleen size. He was mentally collected, initially felt groin pain, then bilateral leg pains, before having a comfortable night with improved urine quality. The crisis took place on the 9th day, but the fever relapsed on the 12th day, accompanied by a re-swollen spleen and deafness. 3 days later, the spleen decreased in size, and while his deafness lessened, he experienced leg pains and nighttime sweating. The crisis occurred again on the 17th day, without any sensory disturbances during this relapse. In Thysus, Philenus's wife delivered a healthy baby and initially recovered well after the 14th day postpartum. However, she suddenly developed fever with rigors, abdominal pains, and stopped menstruating. A pessary alleviated her symptoms temporarily, but then she experienced recurring pain, insomnia, and unquenchable thirst, along with loose yellowish stools and scanty, colourless urine. As the days passed, her condition worsened. She had disoriented episodes, incoherent speech, and became increasingly delirious. A suppository helped temporarily by prompting a bowel movement, but spasms persisted. Her mental state fluctuated, with moments of slight recollection followed by full-blown delirium. On the 20th day postpartum, her condition deteriorated further, and she eventually became speechless, before ultimately succumbing to her illness. Notable observations included urine that was thick, white, and resembled cattle urine in appearance, despite no sediment or abnormal colour. A woman who had just given birth to a daughter experienced a series of health issues starting on the 3rd day postpartum. Initial symptoms included acute fever, stomach pain, and genital discomfort, which were relieved somewhat by a suppository. Over the next few days, her condition worsened with insomnia, delirium, and severe bowel movements that were bilious in colour. On the 8th day, she had a fever-induced rigor, and while her delirium lessened, her body pains persisted. By the 10th day, her physical discomfort was mostly confined to her limbs and stomach region, but her condition remained unstable. The 11th day saw some improvement as her urine turned a better colour, and she felt slightly lighter. However, a new bout of fever set in around the 14th day, accompanied by vomiting bile and yellow matter, followed by a return to normal body temperature. Her health continued to fluctuate over the next several days, with recurring fevers, delirium, thirst, and persistent pain on her left side, along with a cough. A notable change occurred around the 21st day, when she experienced deafness in addition to these symptoms. Her urine became thick and reddish during this period. The woman eventually entered a period of recovery, becoming free of fever by the 27th day. However, she still had pain on her left side and occasional bouts of bilious vomiting. It wasn't until the 80th day that she experienced a complete crisis and was finally freed from her illness. Patient Cleonactides suffered from an irregular fever, initially experiencing headaches and left-sided pain, along with fatigue-like symptoms. The fever's paroxysms were unpredictable and occurred more frequently on certain days. As the illness progressed, he experienced cold hands around day 24, followed by frequent and intense vomiting of yellow bile that later turned green.
He also had irregular nosebleeds starting from day 30.
Notably, Cleonactides didn't exhibit typical symptoms like a strong desire for water or aversion to food during this period. His urine was thin, but not colourless, occasionally containing a sediment. Around the 30th day, his urine turned reddish with a red sediment, bringing temporary relief. However, the urine's characteristics fluctuated over time, sometimes containing sediment and at other times being clear. By day 60, the sediment in his urine became copious, white and smooth, coinciding with an improvement in symptoms, the fever's remission, and thin, well-coloured urine. The patient remained fever-free for 10 days until a rigor and acute fever recurred on day 80, accompanied by profuse sweating, reddish urine with a smooth sediment, and a clear crisis. In case 7, Meton contracted a fever accompanied by a painful sensation in the lower back. After drinking plenty of water and having a bowel movement the next day, symptoms worsened on the 3rd day with headaches, thin, bilious stools, and blood from his right nostril at night. The 4th day brought further exacerbation of all symptoms, along with continued bloody discharge from his right nostril and uncomfortable sleep. On the 5th day, Meton experienced a massive nosebleed on his left side, followed by sweating and entering crisis. Post-crisis, he was restless, delirious, and had dark-coloured urine until an enema of warm water helped him recover his senses. Although there was no relapse, Meton suffered from recurring nosebleeds after the crisis. Case 8. Erasinus, residing near the Canal of Boots, developed a fever after dinner.
He spent the first night restless and agitated, then experienced pain during the day on the 2nd day, followed by more severe symptoms at night, including delirium.
On the 3rd day, he was in intense pain with disorganized thinking. The 4th day saw him in an uncomfortable state with no restful sleep. Instead, he dreamt, talked, and exhibited alarming symptoms of fear and impatience. By morning on the 5th day, Erasinus appeared coherent, but soon became violently mad, unable to control himself, exhibiting cold and livid extremities, dark urine without sediment, and continued bowel movements throughout his illness.
He died around sunset with spasms and sweats intensifying in the hours leading up to his passing.
In Tarsus, Crichton was suddenly struck by a severe pain in his big toe while walking, forcing him to go straight to bed. That same day, he experienced chills, nausea, and then a slight return of body heat before becoming delirious at night. The following day, his entire foot became swollen, accompanied by redness and distension around the ankle, as well as small blisters. Crichton's fever was intense, causing him to become violently agitated. He also suffered frequent bouts of bilious diarrhea, without any blood or mucus mixed in with the stool.
He passed away on the second day after the onset of his symptoms.
Case study. A Clazomanian individual was hospitalized near Phoenicides well after developing a fever, head, neck, and back pain, followed by deafness, insomnia, and elevated hypochondria with swelling, but not severe distension. Symptoms worsened over the next few days, but around day 11, there was a slight improvement. The patient's bowel movements were initially frequent, watery, and abundant from days 4-14, then became constipated.
Urine remained thin and clear throughout most of the period with some scattered substances, but no sediment.
Around day 16, the urine thickened slightly with a small amount of sediment, improving further by day 17. However, fever returned on day 18, accompanied by ear pain, incoherence, and leg discomfort. The patient experienced a crisis around day 20, free from fever, with no sweating or other issues. By day 27, they had a sharp right hip pain that subsided quickly. Around day 31, the person developed a watery diarrhea with dysentery symptoms, followed by thick urine output and complete resolution of ear swelling. Finally, around day 40, they experienced eye pain in the right eye, with diminished vision, which eventually cleared up. Case 11. The wife of Dromedes gave birth to a female child and initially recovered well. However, 2 days later, she suddenly developed chills, high fever, and abdominal pain in her hypochondrial region. She experienced nausea, insomnia, and infrequent, labored breathing. On the day following, her bowel movements returned to normal, but her urine was abnormally thick and milky, with no sediment. She had a restless night with no sleep. On the third day, she suffered another rigor and high fever, with persistent abdominal pain, nausea, and an uncomfortable night without sleep. Her body temperature fluctuated, with brief episodes of coldness followed by restored heat. On the fourth day, her hypochondrial symptoms somewhat subsided, but she experienced headaches, dizziness, a minor nosebleed, dry mouth, thirst, and thin, oily urine. She dozed off briefly, only to wake up disoriented again. That night, she slept fitfully and was delirious upon waking. Her skin felt cold, and she lapsed into unconsciousness with rare, labored breathing. Shortly before her death on the 6th day, a rigor struck once more, but it was followed by profuse sweating all over her body. Her extremities were cold, and she became delirious again just before succumbing to spasms in her head, leading to her untimely demise. A man experienced a sudden outburst and consumed a large amount of food and drink, leading to vomiting throughout the night.
He developed an acute fever, abdominal pain, and internal inflammation.
His urine initially appeared thick and red, but cleared up after settling, with his tongue being dry and thirst minimal. Over the next few days, his symptoms worsened.
He suffered from widespread pains on the 4th day, followed by smooth, oily, and abundant urine.
By the 6th day, he became incoherent at night without sleep. On the 7th, all his symptoms intensified, along with frequent talking, diarrhea with worms, and a restless night. The morning of the 8th brought a rigor, hot sweat, and apparent relief from fever. However, he didn't sleep long before experiencing a chill and drooling saliva.
He continued to exhibit great incoherence that evening, followed by vomiting dark bile.
On the 9th day, he felt cold and delirious without sleeping. His symptoms reached their peak on the 10th, with widespread limb pains and further confusion leading to his eventual demise on the 11th day. A woman who was 3 months pregnant, staying at the quay, experienced a severe illness. She developed a high fever, followed by intense pains in her loins, head, neck, right arm, and hand. The pain eventually caused her paralysis and loss of speech. Her stool became bilious and she suffered from diarrhea. The next day, she regained her ability to speak, but still had spasms, pain, and swelling in her abdomen. She was disoriented, didn't sleep, and continued to have bowel issues with thin and discolored urine. By the 5th day, she experienced a sharp fever, remained disoriented, and suffered from bilious stools. However, as night fell, she broke out in sweat and the fever subsided. The following day, her mental clarity improved, but she still had pain near her left shoulder blade, was thirsty, didn't sleep, and had thin urine. On the 7th day, she experienced mild tremors, occasional confusion, and continued to have pain in her left arm and clavicle. By that point, her condition had largely improved, with coherent speech. For 3 days, she remained free of fever. However, on the 11th day, she relapsed into a fever accompanied by chills. By around the 14th day, she vomited bile and yellow matter, had another sweat, and finally recovered from the illness as her fever came to a natural end. Case 14. Melidia, who lived near the temple of Juno, suddenly developed severe headaches, neck pain, and chest discomfort. She quickly fell ill with high fever, mild menstruation, and persistent pains in these areas. By the 6th day, her symptoms worsened with coma-like states, nausea, chills, flushed cheeks, and a hint of delirium. On the 7th, she had a sweat and the fever subsided, but pain persisted. There was a relapse, minimal sleep, and her urine remained clear but thin. Her bowel movements were infrequent, pale, bitter, and foul-smelling with a black, smooth sediment at the bottom. After another sweat, she experienced a complete recovery on the 11th day. Book 3 of the Epidemics, Section 1. Case 1. Pythion, residing near the Temple of Earth, initially experienced trembling in his hands, accompanied by high fever and delirium, with symptoms worsening over the first 3 days. On the 4th day, he had scanty bilious bowel movements. By the 5th, his condition deteriorated further with little sleep and constipation. By the 6th day, his sputum was mixed and reddish. On the 7th, his mouth drooped. By the 8th day, all symptoms worsened again, including constant tremors, thin urine lacking color, and cloudy sediment. After a crisis on the 10th day, marked by sweating and somewhat digested sputum, his urine became slightly thicker around the time of the crisis. Following the crisis, an abscess developed near the anus on the 40th day, but resolved through strangury, painful passing of urine. Interpretation of patient's progress. The massive release of urine likely contributed to the successful treatment outcome, resulting in the patient's recovery by the 40th day. Case 2. Hippocrates, who lived near the New Wall, developed a fever with symptoms that persisted for several days. Initially, he experienced headaches, back pain, stomach discomfort, dry mouth, hearing loss, insomnia, and dark red urine that didn't settle at the bottom when left to stand. His bowel movements were also dry, but not scanty. On the 5th day, his urine became thinner and contained floating particles. That night, he became delirious. By the 6th day, jaundice appeared, and all symptoms worsened, with no memory recall.
He remained in an uncomfortable state until around the 11th day, when some symptoms subsided.
A coma set in, followed by improved mental clarity, but urine remained thin with floating particles and no sediment. The fever eventually disappeared on the 14th day, along with sleep and a sense of collectiveness. However, he still had no appetite, dry tongue, and thirst was absent. Around the 17th day, Hippocrates experienced a relapse, becoming hot again and entering an acute fever phase. Deafness persisted throughout his illness. On the 20th day, he entered a crisis state, free from fever, with no sweat or appetite, but in deep sleep. He remained in this state until the 24th day, when he had another heat spike, looser bowels, and watery discharges. The acute fever returned on subsequent days, accompanied by a parched tongue. Hippocrates eventually died on the 27th day. His urine was either thick and red, with no sediment, or thin and colourless, with particles floating in it. His sense of taste had been absent throughout. Character summary and cause of death. The character's demise likely resulted from a lack of bowel movements rather than any other factor. On the 27th day, following an initial incident or treatment that might have involved hindering natural bodily functions. A patient in the Garden of the Elseys experienced a prolonged illness with symptoms that evolved over time. Initially, he suffered from headaches and fever, accompanied by blood discharge from his left nostril. Subsequent days showed worsening conditions. Coma, dark stools, frothy urine, and swelling in the right hypochondrium. The 7th day marked a significant deterioration, with a chill, rigor, delirium, strabismus of the right eye, dry tongue, and thirst. Fever persisted through the 10th day before the patient experienced a brief period of recovery and normalcy. However, fever returned on the 14th, along with insomnolency and complete delirium. The next few days were marked by variations in urine color, frequency of bowel movements, and pain in various parts of his body: legs, knees, hip joint, right eye. The patient experienced a complete crisis around the 40th day, characterized by frequent white, pituitous stools, profuse sweating, and overall improvement. A summary of the patient's recovery can be attributed to the elimination of bodily waste products, stool, urine, and sweat,
which likely occurred within a 40-day period leading to their cure.
Section 1. In Tharsis, Philistes suffered from a persistent headache that sometimes forced him to bed and made him prone to deep sleep. His condition worsened after experiencing frequent fevers due to excessive drinking. Initially, he felt hot at night. Then, on the first day, he vomited bile-colored matter, followed by increased bowel movements and an uncomfortable night. The next day brought deafness, high fever, and retraction of his right hypochondrium. His urine was thin, transparent, with small particles floating in it, and he experienced delirium around midday. By the 3rd day, his condition remained uncomfortable. On the 4th, convulsions set in, and all symptoms intensified. Philistes eventually succumbed to his illness on the 5th day, early in the morning. A possible cause for the patient's death on the 5th day is a severe brain inflammation, phrenitis, accompanied by unsuccessful treatments or purging measures. Charion, who was staying at Damaenetus's house, developed a fever after drinking and began experiencing symptoms like headaches, insomnia, and gastrointestinal issues with bilious discharges. Over the next few days, his condition worsened.
He experienced acute fevers, convulsions, delirium, and remained restless at night.
On the 6th day, Charion's symptoms persisted, but on the 7th, a rigor and acute fever led to sweating and a crisis.
His bowel movements remained bilious, scant, and unmixed.
His urine was thin, with cloudy sediment. By the 8th day, his urine had improved in color and contained a white sediment.
He went into remission but relapsed around the 9th day.
The relapse brought on yellow, bilious vomiting around the 16th day. Charion's condition again reached a crisis point on the 17th, with a rigor, acute fever, and sweating, after which he was free of fever. His urine, post-relapse and crisis, was well colored with sediment, and he didn't experience delirium during this period. On the 18th day, Charion had some residual symptoms. mild heat, thirst, thin urine with cloudy sediment, and slight mental confusion.
He fully recovered by the 20th day, marking a complete crisis.
The character's recovery likely occurred within 20 days, attributed to their frequent passage of bile-rich stools and urine. Note: the bracketed number might be a footnote reference or citation. Case 6E. A young girl, daughter of Euryanax, fell ill with a fever. Despite being free of thirst, she showed no appetite for food. Her urinary discharge was small, thin, and pale, while her stools were initially small and pale too. Initially, she experienced a painful sensation in the gluteal area. By the 6th day, her fever subsided, but she didn't sweat. Instead, she had a crisis, and a small abscess on her buttocks burst at that time. After the crisis, she developed a chill, felt slightly warm, and then sweated. On the 8th day, after the chill, she experienced another mild chill. Thereafter, her extremities remained cold. Around 10 days into her illness, she had a sweat-induced episode of delirium, followed by a brief period of clarity. These symptoms were reportedly triggered by eating grapes. After a 12-day interval, incoherent talking resumed. Her bowel movements became disordered with frequent thin and acrid discharges, requiring her to get up frequently. Unfortunately, she passed away 7 days after the return of delirium. At the onset of the disease, she experienced pain and redness in the throat, accompanied by a retracted uvula, excessive defluxions, discharge, and an abundance of thin, acrid mucus. She had a persistent cough, but no expectorated sputum. Throughout her illness, she showed no interest in food or drink and remained silent with a sense of hopelessness. A congenital predisposition to tuberculosis was also noted. Case 7. A woman with quinsy stayed at a Rishan's house. Initially, her condition started in her tongue. It was red, dry, and her speech was slurred. The first day, she felt chilly, but then developed a fever. By the 3rd day, she had a severe chill, high fever, and a painful swelling on both sides of her neck and chest. Her extremities were cold and pale, breathing labored, and she could not swallow due to difficulty with saliva flowing back up her nose. Bowel movements and urination ceased.
The condition worsened by the 4th day.
6 days later, she succumbed to quinsy. A possible factor contributing to the fatality on the 6th day might be the unsuccessful attempt to halt the patient's bodily secretions, which ultimately proved detrimental. Case 8. A young man, exhausted from labor and traveling during an unfavorable time of year, fell ill at Liar's Market. His symptoms worsened daily. Day 1.
Fever led to diarrhea, thirst, and insomnia.
Day 2. Symptoms intensified. More frequent and unusual bowel movements, continued lack of sleep, mental disorientation, and slight sweating. Day 3.
He became restless, experiencing increased thirst, nausea, and delirium. His skin was cold, his limbs were blue, and he had abdominal tenderness on both sides.
Day 4 to 7. The patient remained awake, with symptoms continuing to deteriorate until his death at around 20 years old. Character analysis and speculation on cause of death. It's likely that the sudden death on the 7th day can be attributed to the unusual activities described earlier, which triggered a severe illness. Case 9. A woman staying at Tisamena's house was afflicted by severe pelvic pain, frequent vomiting, inability to retain liquids, discomfort in the upper abdomen, and cramping in the lower part of the belly. She experienced constant discomfort, no thirst, hot flashes, cold extremities, nausea, and insomnia. Her urine output was low and watery, and her bowel movements were thin, undigested, and sparse. Despite treatment attempts, she did not improve and eventually passed away. A woman staying at Pantamides developed a high fever after a miscarriage. Initially, she experienced dry mouth, thirst, nausea, insomnia, and digestive issues, with frequent watery and undigested bowel movements. On the second day, she had a severe chill, intense fever, and continued to have loose stools. Her sleeplessness persisted. By the third day, her pains intensified. Delirium set in on the fourth day, and by the seventh she passed away. Throughout her illness, her stomach remained loose with frequent thin, undigested bowel movements. Her urine was scanty and watery. An intense fever characterized her condition. Case 11. Hippocrates' wife suffered a miscarriage around the 5th month of pregnancy and soon developed fever. Initially, she experienced alternating states of unconsciousness and sleepiness, as well as back pain and headaches. The second day brought bowel irregularities with scant watery stools. By the third day, her symptoms worsened. Frequent unformed bowel movements during the night and lack of rest. On the fourth day, delirium set in, accompanied by fear, despair, a squint in her right eye, a cold sweat on her forehead, and cold, discolored extremities. By the 5th day, all symptoms had intensified. She spoke incoherently, then suddenly became coherent again, showed no signs of thirst, remained sleepless, experienced frequent unseasonable bowel movements, and produced scant dark urine. Her limbs stayed cold and bluish. She remained in this state on the 6th day before passing away on the 7th, likely due to phrenitis, a type of brain fever. A 17-year-old woman, having recently given birth and experiencing a difficult labor, developed severe symptoms of an intense fever. Initially, she presented with thirst, nausea, chest pain, a dry tongue, irregular bowel movements, and insomnia. Her condition worsened over the next several days, characterized by rigors, shivers, high fever, sweating, cold extremities, and constant restlessness. On the 8th day, her symptoms shifted. She became comatose, vomited yellowish bile, and experienced frequent urination without awareness. Her condition began to improve on the 9th day, but then relapsed with a rigor, fever, vomiting, and lack of sleep. The woman's symptoms continued to fluctuate over the next few days, including green-colored bile vomiting, rigors, cold extremities, and severe pain. On the 12th day, she experienced copious black and foul-smelling vomits, intense hiccuping, and painful thirst. Her condition deteriorated further on the 13th day with persistent black and fetid vomiting, rigors, and loss of speech. Ultimately, on the 14th day, the woman died after experiencing bleeding from her nose. Throughout her illness, she struggled with loose bowels and an intense fever that persisted for nearly 2 weeks. Her age at the time of the severe fever was approximately 17 years old. Section 3. Constitution 2. The year was characterized by a prevailing southerly wind pattern. A drought preceding the year led to significant rainfall when the south winds changed direction around the time of Arcturus's rising in autumn. The subsequent seasons followed a similar trend. Winter had a damp and mild climate, while spring brought plenty of rain until the dog days of summer. Summer itself was hot with occasional suffocating heat waves, and the Etesian winds were weaker than usual. As the year transitioned towards winter, there were brief periods of unseasonal northerly weather around the equinox. Due to this generally mild climate, everyone remained healthy except those suffering from phthisis, tuberculosis, topic discussed later. In the early spring, amidst prevailing cold, various epidemics occurred. Some cases of erysipelas emerged, both with and without apparent causes, proving fatal to many. Many people experienced sore throats, loss of speech, and ardent fever. Other prevalent illnesses included mental disorders, mouth ulcers, genital tumors, eye inflammation, ophthalmia, anthrax, digestive issues, anorexia accompanied by thirst or its absence, disordered urine, coma, insomnia, failure to recover from illness, unfavorable recovery outcomes. Many patients suffered from these conditions, and numerous fatalities resulted. The symptoms of each of these cases were as follows. Erysipelas often broke out across the body, particularly around the head, in people over 60 years old, following an accident or even a minor wound if left untreated. The condition could spread rapidly, causing great inflammation and massive suppuration, with tissue necrosis, sloughing of skin, tendons, and bone. In severe cases, hair loss occurred, along with exposure of the skull and facial bones. Runoff from these wounds was not pus-like but resembled putrefaction. While such symptoms might appear alarming, many patients recovered once the inflammation subsided and suppuration ensued. However, if erysipelas disappeared without forming an abscess or other resolving symptoms, it often proved fatal. The condition could affect any part of the body, leading to amputations in some cases. When it affected the genital area, the consequences were particularly severe. Erysipelas could occur with sores triggered by external causes, but also spontaneously during fevers or post-fever periods. In general, when abscesses formed and turned into suppurations, or if a patient experienced a timely diarrhea or good urine output, their condition improved. Without such resolution, the disease was more likely to be fatal. Erysipelas cases were most common in spring, but could persist through summer and autumn. In some instances, chaos ensued, accompanied by growths on the throat, inflammation of the tongue, and abscesses around the teeth. Many people suffered from speech difficulties or complete loss of ability to speak. Initially, those with early stages of tuberculosis were affected, but also individuals experiencing severe fever or delirium. In early spring, after a cold spell, there was an outbreak of severe fever cases with high mortality rates. The typical symptoms of ardent fevers at the onset were coma, nausea, shivering, mild fever, no intense thirst or delirium, occasional nosebleeds, and paroxysms that often occurred on even days. As the paroxysms struck, patients experienced memory loss, weakness, speech difficulties, and their extremities became extremely cold, slowly warming up later. The afflicted often suffered from insomnia with accompanying pains, as well as bowel disorders with frequent watery stools.
Urine output was copious but unremarkable.
There were no signs of crisis or proper evacuations before death, which typically occurred around the time of crisis, although some patients died later after losing speech and experiencing profuse sweating. Similar symptoms were seen in phrenitis cases, except for a lack of intense thirst and absence of wild delirium. These patients usually succumbed to an irresistible urge to sleep and stupor, rather than to the fever itself. Besides the primary fever, there were various other fevers described. Many people experienced mouth ulcers and sores, as well as genital issues like defluxions, ulcerations, boils, and abscesses both internally and externally. Chronic watery eye infections caused pain, while fungal growths on the eyelids and inside the eyes led to sight loss in some cases.
Fungal outgrowths also appeared on ulcers, particularly those around the genitals.
During summer, there were outbreaks of carbuncles, anthrax, and other conditions known as putrefaction or sepsis. Additionally, people suffered from large skin lesions called ecthymata and widespread rashes like tetters, herpetiform eruptions. Many people in the region suffered from severe digestive complaints. Children, particularly those under puberty, were heavily affected by tenesmus accompanied by pain, with many fatalities. While cases of lionetry and dysentery did occur, they were less painful and characterized by bilious, fatty, thin, or watery bowel movements. In some cases, the disease resolved without fever, but in others, it was marked by severe abdominal pain, malignant volvulae, and difficulty passing stool, despite purgative treatments that often worsened symptoms. Ultimately, most patients died either from acute or chronic afflictions of the digestive system, with the belly being the primary organ responsible for their demise. In the cases described, individuals consistently exhibited an unusually strong aversion to food. This phenomenon was particularly pronounced among patients suffering from these specific ailments, as well as those recovering from them and people afflicted with other life-threatening illnesses. While some individuals in these groups experienced excessive thirst, others did not. Notably, neither during febrile nor non-febrile conditions did anyone consume water at an improper time or disregard the instructions given to them regarding hydration. In any instances, the amount of urine produced did not correspond to the volume of liquid consumed. Instead, it was excessive. Moreover, the quality of the urine excreted was poor. It lacked the typical thickness, had an improper consistency, and failed to effectively purge the body. In some cases, a person's urine might initially suggest a positive outcome, but in most instances, such urinary purging signified that the body was breaking down, digestive issues were present, pain was being experienced. Those suffering from phrenitis and calcis often fell into a deep coma, but this tendency was not unique to these conditions. It also occurred in severe illnesses accompanied by fever. Typically, outcomes involved either prolonged unconsciousness, coma, or brief, light dosing, sleep. Around that time, various types of fevers were widespread, including tertian, quartan, nocturnal, continual, chronic, erratic, and irregular ones accompanied by nausea. These fever types caused significant disturbances because in most cases the bowels were disordered, along with rigors, uncritical sweating, and abnormal urine conditions. The illnesses often dragged on, as the usual deposits didn't lead to a critical turning point. Instead, there was difficulty achieving crisis, lack of crisis, and prolongation of the disease, especially in these instances. While some patients experienced a crisis around the 80th day, most cases ended irregularly. Some individuals even died from edema without being bedridden. Furthermore, swelling was a common issue in many diseases, but it was particularly prevalent in pulmonary tuberculosis cases. Consumption was the deadliest disease that affected the greatest number of people during the winter months. It could manifest in two ways. Some patients became bedridden immediately, while others continued to move around, but still struggled with the illness. Those confined to bed typically succumbed early in spring, whereas those who remained mobile often experienced a milder cough throughout summer. As autumn approached, most individuals were bedridden again, and many eventually died, although some cases dragged on for an extended period. The disease's symptoms included frequent rigors, high fever, unseasonable sweats, and extreme coldness that was challenging to warm up. Bowel movements varied from constipation to diarrhea, with a final stage of severe diarrhea before death. A primary characteristic was the collection of mucus in the lungs, which was released through coughing, but without significant discomfort. The patients often experienced excessive, poor-quality urine and had an unrelenting lack of appetite for food or desire for drink. As their condition worsened, they became lethargic, prone to coma, developed swelling that sometimes led to dropsy, and exhibited rigors and delirium before passing away. A certain body type is more prone to respiratory issues like tuberculosis. Those with smooth, pale complexions, resembling lentils, red hair, blue eyes, or a phlegmatic constitution. Similarly, women are more likely to experience melancholic, subsanguineous, frenetic, and dysenteric conditions. Young people with a phlegmatic temperament often suffer from tenesmus, straining. Those with bitter bile are prone to chronic diarrhea, acrid and sticky bowel discharges. For the described creatures, spring was particularly deadly, while summer was more advantageous and resulted in fewer fatalities. Autumn was also detrimental to them, with many dying during this period under the Pleiades star cluster. One reason that the arrival of summer should have had a positive impact, as winter's diseases are cured by the advent of summer, just as summer's diseases are alleviated when winter arrives. However, in this instance, the summer was not inherently healthy. It suddenly became hot, southerly, and calm. Despite its imperfections, summer still proved beneficial by inducing a transformation on their constitution. In my view, being able to accurately assess written work is an essential aspect of this art. One who grasps the commonalities and differences between seasonal patterns and diseases won't likely make significant errors in their practice. To excel, one should thoroughly understand the characteristics of each season and disease. What's typical or problematic about each?
Which illnesses tend to be fatal or recoverable?
And when critical days occur. With this knowledge, it's straightforward to determine the best course of action for feeding patients at the right time. Someone well versed in these matters will effortlessly know how to provide sustenance to individuals, taking into account their specific needs and circumstances. Section 17. 16 cases. A patient in Tarsus experienced a prolonged illness that lasted 120 days. The symptoms began with an acute fever characterized by thirst, drowsiness, and disordered bowels. As the disease progressed, he developed delirium, oily urine, and bilious fatty stools.
He suffered from insomnia and had occasional vomiting of greenish substances.
On some days, he experienced epistaxis, nosebleed, and slight fever relapses. His symptoms would subside only to return, often with increased severity.
He had periods of sweating, followed by chills, and a return to normal body temperature.
Throughout the illness, his urine was consistently thin and of poor quality, and his bowel movements were either loose with bilious waste or constipated with hot, undigested stool. The patient's appetite remained low, and he suffered from insomnia and delirium during periods of fever relapse. The patient eventually succumbed to the disease on the 120th day. Interpretation of the figures involved. The vulnerability brought about by the fever, inflammation of the brain, and issues with the digestive system, hypochondrium, likely led to the person's demise around the 120th day. Case 2. A woman in Tarsus who stayed near the cold water developed complications after giving birth to a daughter. Initially, she had fever-like symptoms before delivery and then suffered from acute fevers, with rigors following childbirth when lochial discharge didn't occur on time. Symptoms progressed as follows: incoherence followed by coherence, diarrhea with bilious stools, no thirst, days 8, 11, onset of coma with copious black urine, and lack of sleep, day 11, recurrence of fever, incoherence, and constipation, days 20-27. pain in the right hip joint, followed by fevers and watery urine, days 27-40, coughs with watery sputum, constipation, food aversion and irregular fevers, days 40-60,
convulsive jaw retraction, coma, speech loss, then regaining coherence and speech, days 60.
death on the 80th day. Throughout her illness, the woman's urine remained black, thin, and watery. She exhibited symptoms of aversion to food, insomnolency, despondency, irritability, and restlessness, consistent with a melancholic temperament. Character analysis. The cessation of uterine bleeding, likely occurring around the 80th day, may have led to fatal consequences for the individual in question. Note: lochial discharge refers to postpartum bleeding. Case 3. Pythion, who lived above the Temple of Hercules in Phasis, developed a severe illness due to exhaustion, fatigue, and poor diet. The symptoms began with strong rigor, high fever, dry tongue, thirst, and dark urine with sediment that didn't settle. Over the next few days, his condition fluctuated.
He experienced coldness, loss of speech and articulation, shortness of breath, and nausea.
His temperature rose and fell, and he had periods of restlessness and sleeplessness. On even days, 2nd, 4th, 6th, and 8th, his symptoms worsened with increased pain, fever, and difficulty speaking. The night before his death, he was agitated and didn't sleep. On the odd days, there were brief periods of relief or improvement, although still experiencing some discomfort. On the 10th day, Pythion's condition dramatically deteriorated.
He became speechless, extremely cold, had a high fever, and excessive sweating. He eventually passed away. Throughout his illness, his symptoms seemed to worsen on even days and improve slightly on odd days.
The text likely suggests that a character's severe sweating may have led to their demise on the 10th day, implying that their sweat-related condition was the cause of their fatal outcome. Case 4. Case 4. A patient with phrenitis, who initially went to bed, experienced significant vomiting of a greenish tint and watery consistency on day 1. They exhibited fever accompanied by chills, persistent sweating all over, headaches, neck pain, thin urine with tiny scattered particles that didn't settle, frequent bowel movements, delirium, and insomnia. On the 2nd day, they lost their ability to speak in the morning.
Fever persisted, accompanied by continued sweating, palpitations throughout the body, and nighttime convulsions.
By the 3rd day, all symptoms worsened, ultimately resulting in the patient's death. The theory suggests that the victim's severe sweating and convulsions likely led to their demise, making it a plausible explanation for their death. In Larissa, a bald man suddenly experienced severe right thigh pain that wasn't alleviated by any treatments. Initially, he had a high-grade fever without agitation, but still suffered from persistent pains. The next day, his thigh pain subsided, only for the fever to intensify.
He was restless, couldn't sleep, and had cold extremities, frequent urination, and poor quality urine output.
By the 3rd day, the thigh pain ceased, replaced by mental confusion, restlessness, and eventually death in the early afternoon of the 4th day. This case illustrates an acute and severe illness. In Abdera, Pericles suffered from a severe continuous fever accompanied by pain, intense thirst, nausea, and difficulty keeping down liquids.
He experienced nasal bleeding on the 1st day, along with swelling around his spleen and a heavy head.
Over the next 2 days, his symptoms worsened, but the color and consistency of his urine changed, suggesting a process of concoction was underway. On the 3rd day, his fever subsided, and he passed a quiet night. A sweat broke out all over his body at noon on the 4th day, marking the end of the illness with no relapse. This was an acute episode of sickness. Case 7. In Abdera, a young woman staying at the Sacred Walk developed an intense fever after experiencing her first menstrual cycle. Her symptoms worsened over several days. She felt nauseous, had chills, and was restless.
Urine tests revealed it was thin but of good color, with no bowel issues reported.
Deafness persisted as her fever raged on. On the 14th day, mental confusion set in, but her fever subsided. On the 17th, she suffered a severe nosebleed, and while deafness slightly improved, nausea, confusion, and disorientation continued. By the 20th, foot pain appeared, and she finally began to recover, experiencing sweat, apyrexia, and the end of deafness and delirium. However, her fever returned on the 24th, accompanied by renewed deafness, lingering foot pain, and confusion. A massive sweat and return to normal body temperature occurred on the 27th. Deafness resolved, but some foot discomfort remained. By this point, she had experienced a complete recovery from the initial illness. A possible reason for the patient's recovery by the 20th day might be attributed to the removal of excess urine from their body, ultimately leading to restored health. In Abdera, a patient named Anaxion, lodging near the Thracian gates, experienced severe symptoms. He developed an acute fever, right-sided pain, dry cough without phlegm, thirst, and insomnia on the first few days. His urine was dark, abundant, and watery. As his condition worsened, he became delirious around day 6, despite warm compresses offering no relief. By day 7, the fever intensified, along with chest pains, a troublesome cough accompanied by shortness of breath. On the 8th day, one performed bloodletting at the elbow, releasing significant amounts of proper quality blood, which alleviated his pain but not the dry cough. By the 11th day, the fever subsided, and Anaxion experienced minor sweating on the head, productive coughs with more liquid phlegm, and felt relief. Following the crisis, he developed thirst again, and his expectorations weren't ideal until the 27th day, when the fever relapsed. He then exhibited a productive cough, thickened sputum, white sediment in urine, and regained normal hydration, along with improved breathing. On the 34th day, he experienced widespread sweating and achieved apyrexia, marking a general crisis. It's likely that removing the pus evacuation of the sputa led to the patient's recovery by the 34th day. A patient in Abdera named Hippocrates initially experienced severe headaches while still on foot. He soon became bedridden and developed an acute intense fever with symptoms including bilious vomiting, excessive thirst, restlessness, and dark urine. His condition was marked by irregular paroxysms of the fever. Around the 14th day, he began experiencing deafness as the fever intensified. After the 20th day, delirium became a prominent feature. On the 30th day, Hippocrates suffered from heavy nosebleeds, followed by less severe hemorrhages at regular intervals.
His deafness persisted but gradually subsided.
The fever also decreased during this period. Around the 60th day, his hip joint started to ache and the fever rose again. Subsequently, he experienced pains in various lower body parts. A pattern emerged where either the fever and deafness intensified or they abated, with the pain in his lower extremities increasing accordingly. By the 80th day, all of Hippocrates' symptoms had resolved without leaving any lasting effects, except for a brief bout of diarrhea that later transitioned to dysentery. However, this digestive issue persisted while the other complaints subsided. Eventually, around the 100th and 120th days, Hippocrates experienced a complete recovery from his ardent fever. Interpretation of the characters involved The successful turn of events, likely occurring on the 120th day, can be attributed to the yellowish-green mucus that was discharged from the individual. Note: in this context, characters refers to individuals or circumstances, not characters in a narrative. Case 10. In Abdera, Nicodemus developed a fever after excessive indulgence in sex and drink. Initial symptoms included nausea, chest pain, thirst, dark urine, and sleeplessness. His condition worsened on the second day with increased fever, chills, vomiting of yellow bile, and poor sleep quality. The third day brought some relief, but discomfort returned at sunset. On the fourth day, he experienced rigors, high fever, widespread aches, and changes in his urine. Despite some respite, symptoms persisted through the fifth day. On the sixth day, Nicodemus reported general pain, floating substances in his urine, and disorientation. His condition improved on the seventh day, but deteriorated again by the eighth, with all other symptoms except pains subsiding. Pains remained, but were less intense and occurred more frequently on even days. 2, 4, 6. By the 20th day, his urine was white and thick sediment, free after standing, and he experienced copious sweating. Although still hot in the evening with pains and thirst, the fever seemed to be abating. On the 24th day, his urine was abundant, white and sedimented.
He broke out in a warm sweat all over, had no fever, and reached the crisis of his illness.
The recovery might be attributed to the patient's elimination of bile and subsequent sweating, possibly playing a crucial role in their healing process. In Tarsus, a woman with a melancholic nature experienced distress after an unexpected sorrowful event. This led to insomnia, appetite loss, thirst, and nausea. Initially, she had frightening experiences at night, spoke excessively, felt despondent, and had a slight fever. In the morning, she suffered from frequent severe spasms, then became disoriented and talked incoherently when the spasms subsided. Her condition persisted into the second day, with no sleep, increasing fever, and more spasms. On the third day, her spasms ceased, but she fell into a coma, only to wake up repeatedly without being able to compose herself. She remained incoherent while experiencing acute fever. That night, she had a profuse sweat all over her body, followed by a period of aporexia and restful sleep. This marked the turning point of her crisis. By the third day after this crisis, her urine turned dark and thin, with floating sediment that didn't settle at the bottom. Shortly after, she experienced heavy menstruation. In Larissa, a young unmarried woman fell ill with a severe fever characterized by insomnia, thirst, and a dry tongue. Her urine was normal in color but thin. After 3 days of discomfort, she began passing frequent, watery, and greenish stools, which brought her relief. On the fourth day, she passed a small amount of thin urine, with visible sediment that didn't settle. She also became delirious by nightfall. On the sixth day, she experienced a severe nosebleed, followed by chills and an intense sweat. Her fever broke, marking a crisis in her illness. Interestingly, this was the first menstruation for the young woman, as it had not occurred previously due to her youth. Throughout her illness and recovery, she suffered from nausea, rigors, flushed face, eye pain, and headaches. Notably, her symptoms worsened on even days, 2nd, 4th, and 6th, but she did not experience a relapse. The fever ultimately came to an end. Apollonius of Abdera struggled with a prolonged illness, initially resisting bed rest despite his symptoms. The fever gradually worsened, manifesting as jaundice, flatulence, and a pale complexion. His diet, which included beef, milk, both hot and cold, and poor choices, likely contributed to the exacerbation of his condition. As the days passed, Apollonius experienced severe symptoms: lack of sleep, gas, intense thirst, drowsiness, painful swelling in the right upper abdomen, and mental confusion with forgetfulness. Around day 14, he suffered a fever-induced rigor, followed by delirium with loud cries, then a period of calm before descending into coma. After recovering from the coma, his bowel movements became irregular, producing varying stool colors, textures, and consistencies, including some resembling milk. A brief respite on day 24 was followed by further deterioration in his condition. On day 30, Apollonius's fever intensified, accompanied by profuse, thin stools, delirium, cold extremities, and loss of speech. He ultimately passed away on the 34th day of his illness, characterized throughout by disordered bowels, dark thin urine, a tendency towards coma, insomnia, cold extremities, and continuous delirium. The case illustrates phrenitis, an ancient term for brain fever or encephalitic disorder. On injuries of the head, the shape of a man's skull can vary significantly, just as their heads do. The suture lines on a person's skull are arranged differently, depending on whether they have a bony prominence at the front or back of their head. If the prominence is at the front, the sutures resemble the Greek letter tau, T, while if it's at the back, they resemble the opposite form of that letter. If there are prominences at both the front and back, the sutures take on the shape of the letter eta, eta. And if a person has no such prominences, their sutures look like the Greek letter chi, k. The skull itself is composed of 2 layers of bone, with a soft, spongy layer in between, called the diplo. The outer and inner layers are denser and harder than the diplo, which is full of tiny cavities and can release blood when rubbed gently. There are also thin, hollow blood vessels within the skull that contain blood. The overall structure of the skull exhibits a range of hardness, softness, and porosity throughout its different parts. The region around the bregma, the top center of the skull, is particularly vulnerable due to its thinness and lack of protective flesh. Injuries there are often more severe, difficult to cure, and deadly, with victims succumbing faster than those injured elsewhere on the head. This sensitivity stems from the large amount of brain tissue in this area, which is exposed by the thin skull and minimal soft tissue coverage. In contrast, the temples, the sides of the forehead, are weaker due to their association with jaw movement and the presence of important structures like the organ of hearing and a major vein. However, the back of the head behind the vertex and ear is stronger, with thicker bone and more protective flesh. As a result, injuries in this area tend to be less severe, and patients may survive longer with a fatal wound. Additionally, pus takes longer to form and penetrate the skull in posterior head wounds due to the thickness of the bone, contributing to higher survival rates for those injured in the back of the head. It's also observed that people typically survive longer with head injuries during winter than summer, regardless of the location of the wound. In regards to marks or dents from sharp or light weapons on bone, when they occur without cracking, bruising, or indenting inward, death typically doesn't result from these alone.
The same is true for both the front and back of the skull.
However, if a suture, a natural seam in the bone, is exposed in an open wound, regardless of where it's located on the head, this can be the weakest point to resist a blow or weapon, especially when the weapon strikes the suture directly. This is particularly true at the bregma, the weakest part of the skull, and if the sutures are nearby the wound and get hit by the weapon, death becomes more likely. Therefore, the skull is susceptible to injury when a fracture occurs. A broken bone in this region will inevitably cause contusion at the point of fracture and surrounding areas due to the instrument causing the break. This is the primary manner in which a bone can be wounded. There are numerous variations within each type of fracture,
Fine fissures that may not be immediately detectable, as well as wider ones that could potentially be visible.
These cracks in the bone can differ in terms of their extent, from short to long, and shape, straight or curved. Some fractures may penetrate deeply through the entire bone, while others might only affect a portion of it. The diversity of fracture types presents various challenges for diagnosis and treatment. A contusion can occur in a bone without causing a fracture. There are various degrees of contusions, ranging from slight to severe, and affecting different parts of the bone. However, it's not possible to visually determine the extent or form of a contusion by simply looking at it. This is true even immediately after the injury occurs, regardless of whether the bone was actually bruised, just like with certain types of fractures that aren't visible from the outside and are located away from the initial point of trauma. When a bone fractures, it can sometimes sink inwardly from its natural position due to the break. This depression occurs because the fractured portion is pushed inwards, while the rest of the bone remains undisturbed, resulting in a combination of fracture and depression. This is the third type. There are various forms of depression, which can involve different sizes of bone, varying depths or superficiality, and different degrees of extent. There are 4 modes of injury when a weapon strikes a bone. 1. A simple indentation, hedra, without fracture or contusion. 2. An indentation accompanied by a fracture, which always comes with some degree of contusion. 3. An indentation accompanied by contusion in the surrounding bones, but no fracture. And 4. An indentation écras, combined with both a fracture and a contusion. In each mode, there can be various degrees of contusion and fracture. The shape of the hedra or indentation can also vary greatly depending on the weapon that caused it. It could be long, short, curved, straight, circular, deep, narrow, broad, or extremely broad. A cleft or notch in a bone would only be considered a hedra if the surrounding bones remain intact and not displaced inwardly. If the surrounding bones are driven inwards, the injury would instead be referred to as a depression. A bone may be fractured in a location separate from where an individual suffered a wound to the skull, and the bone could now be exposed. This is the 5th possible scenario. Unfortunately, once this occurs, there's no way to diagnose it through examination, nor determine the affected area of the head, as there are no visible signs or indicators. Of the various types of fractures, those that necessitate trepanning include contusions with or without bone exposure and fissures, whether visible or not. Additionally, if an indentation caused by a weapon leads to both fracture and contusion in a bone, or even just contusion alone, trepanning is required. However, a bone that has been depressed from its natural position usually doesn't need trepanning unless it's severely broken. The opposite is true for bones with significant pressure and fractures, which often require less intervention. Trepanning is not necessary in cases of indentations without accompanying fracture or contusion, nor is it required for large, wide notches, which are equivalent to indentations. Initially, when examining a wounded person, assess where on the head the injury is located in stronger or weaker areas. Observe if hair near the wound has been cut off by the instrument and is now inside the wound. If so, note that the bone may be exposed and potentially injured. This initial evaluation can occur without physically touching the patient. During a more detailed examination, confirm whether the bone is denuded of flesh or not. If visible to the naked eye, this is sufficient evidence. Otherwise, use a sound testing method to determine if the bone has been denuded. If it has, assess the condition of the bone and the extent of any damage. Also, ask the patient how they sustained their injury. If the bone's state isn't immediately apparent, inquire about the wound's origin and circumstances, especially when contusions or fractures might be present, but not visible. In these cases, rely on the patient's account to determine if a bone has been injured, then use observation and non-sounding methods to further assess the situation.
Sounding can reveal indentations, displaced bones, and severe fractures, which can also be observed visually.
The text discusses the types of injuries that can occur to bones and the surrounding flesh when struck by various objects. It emphasizes that a bone can suffer fractures, either visible or not, contusions, depression from its natural position, and other trauma due to intentional or unintentional blows, falls, or instrument strike. The severity of injury depends on factors such as the height of the fall, the hardness and shape of the object striking the bone, and the relative strength and size of the person being struck. The text highlights that falling from a great height onto a hard, blunt surface increases the risk of bone fracture and depression, whereas landing on softer ground may result in less severe injuries. It also notes that the shape and weight of an instrument can greatly impact the nature of the injury it inflicts upon the head or bones. Weapons with rounded, smooth surfaces tend to produce more severe, suppurating wounds due to their bruising and compressing effect on the flesh. In contrast, slender, sharp instruments are more likely to cause cuts or hedra, a term for a cut that also involves an inward depression, without inducing contusions or fractures. Finally, the text suggests that inquiring about symptoms such as dizziness, loss of consciousness, and blurred vision can provide additional insight into the severity of the injury. These signs can serve as indicators of more significant trauma to the bone and surrounding tissues. When a bone is exposed and the wound occurs at the suture lines, distinguishing between the natural indentation, hedra, of the suture and the mark left by a weapon can be challenging. This is especially true if the wound is small or situated directly on the suture itself. The rough texture of the sutures can cause confusion, making it difficult to determine which marks are from the suture and which from the weapon, unless the weapon's mark is quite prominent. In addition, when a fracture occurs at the suture line, it can be even harder to detect because the bone is naturally weaker there. The surrounding bones tend to remain intact due to their greater strength. If the bone is broken and indented by a weapon at the suture, it may be difficult to determine whether the break occurred from the indentation or from trauma to the bone itself. When trying to diagnose injuries that occur at the sutures, it's crucial to pay close attention to the extent of the damage, as even minor blows can cause significant harm if they land on the suture lines. In some cases, trepanning may be necessary, but this should not be performed directly on the suture itself. Rather, it should be applied to the adjacent bone. The author advises that for head wounds, avoid using liquid or applying cataplasms and bandages, except around the forehead, eyebrow, and eye. This is because other areas of the head can become inflamed due to blood influx from surrounding parts. Even in these specific areas, cataplasms and bandages should be removed once inflammation subsides. The author also emphasizes that incision may be necessary for wounds on the head if the bone is exposed and the wound doesn't allow for a clear inspection of the bone's condition. This is especially true for ulcers where the bone has been damaged or denuded of flesh. For certain types of wounds, such as those that are circular and hollow, incisions should be made lengthwise to facilitate treatment. However, the author warns against making incisions on the temple area due to a risk of convulsions. as this region contains an important vein. If an incision is made on the left or right temple, the resulting convulsions will affect the opposite side of the body.
When opening a head wound that exposes bone due to flesh removal for blow injury assessment, make an incision proportional to the wound size and necessary depth.
Separate the remaining flesh from the pericranium and bone. Then fill the wound with a tent to expand it minimally painful the next day. Apply a cataplasm of flour in vinegar or boiled flour paste along with the tents. The next day, inspect the bone for injury after removing the tent. If the bone damage is not visible, despite the appearance of instrument penetration, scrape the bone with a raspberry to a depth and length corresponding to the patient's sutures, both longitudinally and transversely, to uncover any unapparent fractures or contusions. If the blow has left an indentation on the bone, dint, scrape it and surrounding areas to reveal any combined fractures, contusions, or underlying damage. If the wound requires treatment within 3 days, especially in hot weather, perform it immediately. When the situation suggests a broken, contused, or both injured bone due to the severity of the wound, patient's description and knowledge of the weapon used, e.g. strong person, dangerous weapon, symptoms like vertigo, but the extent of the damage is unclear. 1. Dissolve black ointment. Fill the wound with it when dissolved. Apply a linen rag smeared in oil, then a mazer cataplasm and bandage. 2. Clean the wound the next day and scrape the bone with a raspberry to assess the damage. If the bone is fractured and contused, the scraped surface will be white except for the blackened fracture and contusion areas, which indicate the extent of the damage. Further scrape the fracture until it disappears, indicating contusion. Or, if the fracture extends deeply, consider trepanning, followed by standard wound treatment. In summary, this text provides a step-by-step guide on how to assess and treat head wounds at exposed bone, including scraping the bone with raspberry to uncover any unapparent fractures or contusions. It also outlines procedures for treating possible bone fractures and contusions, as well as using dissolved black ointment to aid in diagnosis. Be cautious not to harm the bone during treatment if it has been injured. Even if the bone appears sound, any hidden damage from the initial blow could lead to infection if the surrounding flesh becomes inflamed and untreated. The bone can become inflamed and suppurate due to heat and irritation from the surrounding flesh, making prompt healing crucial. A moist and prolonged healing process in an ulcer is undesirable, as it may take a long time for the area to clean and recover. Instead, encourage the wound to suppurate quickly, allowing the injured tissue to release its debris and heal faster. Once cleaned, the wound should be dried to promote rapid recovery when healthy new skin regenerates. This principle also applies to the meninx surrounding the brain. After removing the bone and membrane, it's essential to clean and dry the area promptly to prevent moisture buildup and swelling, which could lead to tissue death if left untreated for an extended period. When a skull fracture occurs due to a blow or prolonged exposure, a loose piece of bone can separate. Typically, this happens when the bone becomes dehydrated and loses its blood supply over time, often as a result of medical treatments. Rapid drying of the wound and the detached bone facilitates separation, as the dried and lifeless bone easily detaches from the still vascularized, intact portion of the skull. The dry, exsanguinated bone is more likely to detach due to its contrast with living, well-perfused bone. When a piece of bone is significantly displaced due to being broken or chopped off, the risk is lower if the surrounding membrane remains intact. Bones with broader fractures are even less dangerous and easier to remove. However, it's crucial not to attempt extraction until the displaced fragments naturally rise back into place following the subsidence of swelling. This occurs when granulations form under the skin, growing from both the sound bone and the diplo, the spongy tissue within the bone. The growth of these granulations is accelerated if the wound suppurates quickly. In cases where both tables of a broken bone are driven inward onto the membrane, prompt treatment can lead to rapid healing and the displaced bones rising back into place. The bones of children are less dense and more porous due to their higher blood content. When injured, they tend to suppurate faster and more easily compared to adults, even with similar wounds. In severe injuries, the younger person is likely to succumb sooner. If the bone is exposed, it's crucial to examine whether it's fractured, contused, or both. If an injury has occurred, a small trephine should be used to release blood while taking great care, as children's bones are thinner and more superficial than those of adults. When someone suffers a severe head wound that's fatal and can't be treated to save their life, certain symptoms can indicate their impending death. If a bone in the skull is broken but not properly diagnosed or treated, fever typically sets in within 7 days in summer and 14 days in winter. As a result of neglecting the injury, the wound may appear discolored, sticky, and tawny. The bone will then begin to decay, turning black before becoming pale. In this situation, patients often develop blisters on their tongue and die with delirium. Convulsions usually affect the opposite side of the body from where the wound is located. For example, if the wound is on the left side, convulsions occur on the right. Some individuals may also experience apoplexy. If you notice these symptoms accompanying fever in a patient, it's crucial to intervene by sawing or scraping the bone, if accessible, and applying appropriate treatment considering the individual's condition. Delays can be fatal within 7 days in summer and 14 days in winter if the wound is left untreated. The presence of these symptoms also indicates the age of the wound, recent or older. When a head wound exposes bone, whether previously operated on or not, a red swollen rash typically appears on the face, possibly affecting both eyes. If the swelling is painful, fever sets in, and if the wound itself looks healthy, surrounded by well-healing tissue, except for this facial edema, which isn't a result of improper care, then administer a medication to purge bile from the system. This treatment usually resolves the fever, subsides the swelling, and enables the patient's recovery. The chosen medicine and dosage must be tailored to the individual's strength and overall condition. When performing trepanning, several considerations are important to know. 1. If you've managed the patient's care since the beginning, it's best not to immediately cut down to the meninx, membranous covering of the brain, because prolonged exposure can lead to fungal infections or other complications. 2. Also avoid cutting too deeply and removing the meninx during trepanning, as this increases the risk of injuring the membrane itself. If only a small portion of bone remains, stop sawing and allow it to fall out naturally, as leaving an unsawed portion poses little harm. In general, treat the wound appropriately after trepanning, considering factors like heat buildup in the bone. To prevent burning the bone with the heated trepan, frequently immerse it in cold water during the procedure. 4. If taking over a case that's already in progress and hasn't been managed by you from the start, perform the trepanning more aggressively. Cut down to the meninx immediately using a serrated trepan and regularly check the instrument path with a sound speculum to ensure accuracy. 5. When using a perforator or trepan, it's crucial not to penetrate directly to the meninx if you've been managing the case from the start. Instead, leave a thin layer of bone in place. By following these guidelines, one can effectively perform trepanning while minimizing risks and complications. End of Vol. 1.